Other than that, these are new questions, so these have not been used on a previous Breakdown the Beast or anything like that. So that'll be fun. And then what other announcements do I have? We'll be releasing our 2026 schedule here by the end of the month. So we'll have all of our test content weekend marathons will be outlined, our boot camp series, our Breakdown the Beast, which we do once a month. All of those things will be outlined for the coming year. And then we have a few other fun things in store for next year too. So you're always welcome to email us if you have questions. Don't hesitate. Shoot us an email, info@behavioranalystsupervisor.com, and we'll be here to help you out. In the chat to chat Bree, you can hit the little three dots and then you can change, or actually there should be like a blue thing when it says two, and you could change it to Bree. She's a co-host. You should only have the option to send it to me or to Bree.
They can also click
You can also click on her name. Oh yeah. I don't know if it's at the top for everyone, is it?
Yeah, because we're the host.
Oh, okay. So you can, yeah, you can click the little three dots by her name and hit chat, or you can click the little blue thing under the chat box, and it will let you change from everyone in or meeting host. You can pick who you chat to. So cool. All right, without further ado, like I said, this will be about between 3 and 4 hours long. The questions are a little bit longer today, so I do anticipate going closer to that 4 hour range. So we should be done between 1 and 2. But we need to get started to be done by then. So let's do it. I'm gonna turn my camera off just so I don't give anything away, and then we have some folks with filters. So but if you have questions, let us know. Chat your questions, and then at the end of each section, so we do 15 questions. And then we just do a short pause to answer any verbal questions. So you'll chat your questions unless you have a specific one that you need to verbalize, and then you can do that at the end of that set. So cool, let's start. I'll read the question aloud and then I'll give you about 1 to 2 minutes to answer it. So Tommy attends a private day school designed to strengthen functional skill repertoires while mitigating severe problem behavior. He has been removed from 3 previous educational placements and has caused significant injury requiring hospitalization to several direct care staff. Upon reviewing his assessment data, you observe that the behaviors emerge reliably when tasks are presented or when access to attention is restricted. You also note a consistent shift in the temporal distribution of the behavior. When the teacher wears colorful clothing, the behavior occurs approximately 30 minutes later than its typical onset. A standardized functional analysis is scheduled in a controlled setting to identify a definitive or the definitive maintaining variables of the behavior. Based on the available information, what can be inferred about the latency of the behavior? A, the latency is not important due to the dangerous nature of the behavior. B, the teacher's clothing has stimulus control over the latency of the behavior. C, the latency of the behavior should be targeted for increase to decrease the magnitude of the behavior. Or D, the latency of the behavior is a direct reflection of the potential function of the behavior and should be used to determine the type of FA to use. All right, here we go. So the answer to this one is going to be B. The teacher's clothing has stimulus control. The teacher's clothing has stimulus control over the latency of the behavior. We'll go ahead and go through every single answer choice as we always do in order to help determine why that is the best answer. We'll try to help you figure out what to focus on from the scenario as well. A few things. So as we know, we have this client who engages in dangerous behavior. So that's obviously important. From there, we're determining. Sorry, 2 seconds. Hold on 1 second, y'all. I just gotta change a link real fast, and then I'll explain this one. All right, let's get back going. Sorry, I had to change a link out. Okay, cool. So B is the correct answer, and we'll talk about why right now. So number one, if we go to answer A, and this is kind of how I want you to dissect it. A says the latency is not important due to the dangerous nature of the behavior. Well, the latency is important, right? Latency is important. However, in this situation, do we need to worry about it? Well, yes. Latency might lead us to what the precursors are of the behavior or what's causing the behavior to occur. If we can modify that latency, then that might allow us to control the behavior. So that's an important part. So latency is important and the behavior is dangerous, but we still might look at the latency. So A is not the correct answer. I'm going to come back to B. So let's go to D, or let's go to C, sorry. The latency of the behavior should be targeted for increase. I like that piece. So we definitely should target the latency for increase because as latency increases, the rate or frequency of the behavior decreases. So as latency increases, the rate or frequency of the behavior will decrease, right? Because latency and rate have an inverse relationship, meaning as one goes up, the other goes down. So I like that. However, the second part does not work. An increase in latency doesn't decrease the magnitude of the behavior, it decreases the rate or frequency of the behavior. So if this said rate or frequency, C is a great answer. It doesn't, so D is not a good answer. So don't pick it. Then we have D. D says the latency of the behavior is a direct reflection of the potential function of the behavior and should be used to determine the type of FA to use. Well, no, it shouldn't be used to determine the type. Now, latency can give you a indication of the function. It's not a direct reflection because latency, though it is a type of FA that we utilize, it's not the strongest type. It doesn't produce the strongest uh, functional relation when it comes to FAs. So that's an important piece to remember. But what we can say, right, is we can say that the color of the shirt has stimulus control. This is where we get confused. We have to remember that stimulus control isn't just that it causes a behavior to happen. Um, it says, or stimulus control means that some measurable dimension of the behavior changes in the presence of a specific stimulus. So what that tells us is in the presence of the colorful shirt, the latency of the behavior has changed. Again, stimulus control is not just causing the behavior to happen or causing it not to happen. It's modifying some dimension, measurable dimension of the behavior. And so that's an important piece. Okay. Cool. Someone said I thought IRT and rate have an inverse relationship. So, if you increase, you're right, IRT and rate do have an inverse relationship. As IRT goes up, rate goes down. But if you increase the latency, that means there's a longer time from the onset of the SD to when the behavior begins. That longer time means there's less instances of or less opportunity for the behavior to occur. So that's what I'm implying there when I say that. Great question. All right. Any questions in your chat, Bree? That I didn't get to?
I think you covered them.
Cool. So I hope that makes sense. Let's go ahead and go on to our next question. Okay. Frankie, or Frank, I don't know why I'm adding an E in there. Frank is a 14-year-old male diagnosed with ASD who demonstrates significant difficulty imitating and sustaining social relationships. When presented with opportunities for social engagement, he immediately begins to tense, become quiet, and perspire. The reaction has occurred during every social opportunity the behavior analyst has arranged. Frank also reports that he now becomes clammy as soon as he sees the behavior analyst. Despite continued exposure to these social demands, only minimal progress is being observed. Which of the following phenomenon is present in this scenario? A, stimulus discrimination, B, operant conditioning, C, primary conditioning, or D, respondent conditioning. All right, we also added slide numbers, so that way if you have a question on one, you can just refer to the slide number if needed. Okay, cool. So what's happening here? Well, there's a lot happening here, but we have an individual who is having trouble with a few things, right? Initiating and sustaining social relationships. So those are important to note. From there, it says that he tends to become tense, quiet, and perspire. These are the responses that are occurring in relation to the stimulus that's present or the encounter, right? Social situations. From there, the question is asking us what is present. So if I look at stimulus discrimination, this is responding one way under a certain set of antecedent conditions and different in the absence of it. And so, no, that's not what we have happening here because he's not responding differently, right? So if it said he only perspires when there's more than three people and doesn't perspire when there's less than three people, then maybe we have stimulus discrimination, but we don't have that there. So that's an important piece to remember. Operant conditioning, on the other hand, operant conditioning is first and foremost, you're looking for something we can choose to engage in or not. Operant conditioning is related to ontogeny. Ontogeny is selection based upon our consequences. So if we are changing what we do based upon our consequences, or you see reinforcement or punishment, then you can select operant conditioning. We don't have that here, so B is not the appropriate answer. From there, we go to C, primary conditioning. Well, primary conditioning is not a thing. So if you pick C, just make sure you're studying up on your AKAs. There's no such thing as primary conditioning. There's Pavlovian conditioning, there is classical conditioning, and there is respondent conditioning. Those are the same thing. Primary conditioning is not an AKA we use for those. We just use Pavlovian, classical, or respondent. So that leaves us with D, which is the correct answer. We can use this kind of process of elimination to get us to the appropriate choice. D is the right answer here. So respondent behavior. The perspiring is respondent behavior. Becoming tense is likely respondent behavior. Becoming quiet might be a choice, but there's an argument to be made that shyness is not something you can control. And so that is kind of a respondent behavior too. Respondent behavior are reflexes. These are behaviors that you don't choose to engage in, they just occur. I do agree with you. There's also respondent conditioning happening here, but we don't have that as a choice. And so one of the things that I want you to learn throughout the course of the next, 3-ish hours that we have together is that you want to answer or select the answer that best fits the scenario. The answer you pick isn't always what you do in real life, and it's not always the best choice based on every given scenario. It's the best choice provided the choices you have. So you're always using the confines of what are my four options and which of those four options best answers the question being asked. So that's what I want you to make sure that you're thinking about. All right, continuing on. We have another long one. Daniel is a 16-year-old learner who engages in who receives home-based services targeting adaptive functioning, academic engagement, and emotional regulation. Over the past month, his caregivers have reported a perplexing behavioral pattern that appears to vary systematically with instructional context. During independent work demands, Daniel initially exhibits mild verbal refusal and subtle withdrawal behaviors, but the responses quickly intensify into forceful complaints, pleading, and attempts to leave the instructional area. Each time this escalation occurs, his supervising therapist momentarily suspends the academic task to allow Daniel to regain composure and avoid further agitation. After several instances of the sequence, the behavior analyst noticed that Daniel begins demonstrating these precursors earlier and with greater speed upon the mere presentation of instructional materials. Additionally, caregivers report that Daniel now starts displaying the same pattern when he hears the therapist's car arrive in the driveway. Which of the following statements best represents what is occurring in the situation? Is it A, the therapist is receiving negative reinforcement by utilizing a punishment procedure and thus increasing their usage of the procedure? B, Daniel is receiving negative reinforcement by engaging in maladaptive behaviors? C, that should say respondent, my apologies. Respondent conditioning is occurring. Or D, a punishment procedure should be considered due to the dangerous nature of the behavior. All right, let's do it. Lots of B's in the chat, some C's, some D's, but lots of B's, and I agree that B is the best answer. So, though there's a lot of information here, y'all are sorting through it really well. Let's figure out why is B the best answer. Well, he engages in these behaviors, and then he's allowed to escape or avoid the consequence, right? So, over the past month, he's engaging in these behaviors. Each time the escalation occurs, the supervising therapist momentarily suspends the task. So he engages in the behavior, he gets to escape or avoid the task. Then he engages in the behavior more quickly and more frequently. That's negative reinforcement. So basically, we have a behavior that's likely escape maintained. We're providing escape to it, which is causing that behavior to increase. That in turn is going to be certainly going to be negative reinforcement. So B is the correct answer. But why not the other ones? So the therapist is receiving negative reinforcement. Well, maybe they're receiving negative reinforcement because they are not having to deal with these emotional outbursts, but they're not utilizing a punishment procedure, right? Instead, they're using a reinforcement procedure. So half of A is right. And a lot of times that's what will happen. You'll get half of an answer that's right, but you'll need to go ahead and go back and say, hey, is both halves of the answer right? C, respondent conditioning is occurring. No, we don't have respondent conditioning here. Instead, we just have operant conditioning. So if that said operant conditioning, then C could work. And then again, this is a behavior he chooses, right? This dysregulation. He's pleading, complaints, right? Those are all behaviors he's choosing to engage in, and that's your initial filter that you want to put questions through between respondent and operant. Is do I choose to engage in it? If yes, then it's operant. If you don't choose, then it could be respondent. And then D, a punishment procedure should be considered due to the dangerous nature. I would not say that pleading and complaints are dangerous behavior. So likely a punishment procedure would not be appropriate in this context. That's going to make B your best answer. B the best answer. Continuing on. Jonas is a 15-year-old student receiving services in an academic program targeting executive functioning, sustained attention, and problem solving. During independent work, he's given two options that both produce reinforcement. Option A consists of completing math problems, which earn him teacher attention delivered on a variable interval schedule that averages 3 minutes. Option B consists of engaging with his organizational checklist, which produce the same source of reinforcement. Based on the principles of the matching law, we can say A, Jonas will engage in proportionate amount of responses for math work and checklists based on the availability of reinforcement, responding sometimes to option A and others to option B. B, Jonas will engage in option A 3 times more frequently than he engages in option B. C, we are unable to determine the response allocation based on the information provided. Or D, Jonas will only engage in option B. All right. Lots of information happening again here. We have lots of A's in the chat, a bunch of A's, almost all A's. Some B's, but almost all A's. Um, yeah, A is not the answer here, y'all. D is going to be the answer, and let's go ahead and go through it. So this is a great learning opportunity. I know, just so y'all have some background, B is Bree. Bree is currently studying right now, and she does not love learning by failing. She wants to succeed at first, but I want to teach all of y'all and her that we can learn based upon getting a question wrong, because now you remember, hey, I picked this and that wasn't the answer. So why was D the answer? Well, first and foremost, we have to remember the matching law does relate to concurrent schedules. Here we have a concurrent schedule. You have what is this, math problems, and then you have organizational checklists. So you have these two different behaviors you can engage in. Now, the matching law is only relevant when you have two interval schedules. We have a variable interval 3-minute schedule, and then you just have completion of the organizational checklist. So this is one checklist. So is what it seems like. So what this tells us is that one is on a ratio organizational checklist, whereas the other one is on an interval schedule. Interval schedules, if we have two interval schedules, then we know they elapse simultaneously. We don't have two interval schedules, we only have one. If you have a ratio in an interval, you're always going to engage in the behavior that's on the ratio schedule if you can complete it quicker, obviously, than the interval schedule. Um, the reason for that, right? So like behavior goes where reinforcement flows, obviously. If I could do something one time, I'm just gonna keep doing that. I'm gonna do it, I'm gonna do it, I'm gonna do it, I'm gonna do it. I'm not gonna wait to access reinforcement. Now, say this were variable, let's just make it easy. Say this were a fixed interval 3-minute schedule and a fixed interval 6-minute schedule for the organizational checklist. Then I would do math problems 2 times as frequently as I would do the organizational checklist because math problems would be available 3 and then another 3 is 6. So twice before my 6-minute schedule elapses once. But if you don't remember anything else, I really, really, really want you to remember that our matching law, in order for it to apply, you have to have two intervals. If you don't, and you have two ratios or a ratio and an interval, you're just going to do the quickest ratio more frequently. That's how that matching law is going to work. Cool? Sweet. We have slide numbers. Don't forget at the end of each section, if you need to vocalize questions, we can do that. But if you have written ones, I can answer them.
But it says the same source of reinforcement. Wouldn't that mean the checklist also produces a BI read?
So someone asked in the chat, it says the same source of reinforcement. That just means that they're getting teacher attention. It doesn't say the same availability of reinforcement. It says the same source. The source of reinforcement is the reinforcement you're getting. The variable interval is the reinforcement schedule for the first one. It doesn't say the same reinforcement schedule or the same availability of reinforcement. It says the same source. I could have also put the same type, or I could have put the same reinforcer, not the same schedule. That's the difference there. It needs to say the same schedule. Source is just type of reinforcement or where the reinforcement's coming from. It's not the amount.
So the word source seems to have been what tripped most people up.
Yeah. Source just means type of reinforcement, y'all. So like source is where it's coming from, not how often it's coming. So cool. Let's keep rolling. All right. You begin reviewing case records and all available data for the client for a new client. After this initial step, you operationally define the target behavior in observable and measurable terms. Then evaluate the precision of the definition by collecting IOA data. Once the operational definition demonstrates strong believability and reliability, you compare baseline data to the intervention data, ensuring the evaluation concludes with the withdrawal of the independent variable. To fully achieve the 3 goals of the science, you should also A, hypothesize the function of the behavior, B, look at the baseline data without taking into account the intervention data, C, take treatment integrity data as well, or D, test the operational definition with novel individuals. All right. So, first off, you have to remember what are the three goals of our science. So, goal one, prediction. Goal two, um, description. Goal three, verification. So, we're looking at prediction, description, and control is what we're looking for, right? Prediction, description, and control. So, what do we have here? Well, after you've created an operational definition, so that's cool. That means we have described the behavior. So, that tells us we have description. We have compared baseline to you compare baseline to intervention, ensuring the evaluation concludes with the withdrawal of the independent variable. So we have verification. So we have verification, we have description. We don't have prediction. We've taken baseline data, but we haven't said like, oh, it's gonna remain the same forever. So we're missing prediction. So now you want to find what answer fits prediction. A, hypothesize the function of the behavior. I like that. Prediction tells us, right? Prediction tells us that if nothing changes, this will stay the same. Prediction is basically saying like, hey, the behavior is this, or the behavior will happen this much, or whatever the case is. So I like A. B, look at baseline data without taking into account the intervention data. Just looking at the baseline data isn't enough. Taking the baseline data and saying it will remain the same forever would qualify as prediction, but as written, B doesn't. C, take treatment integrity data as well. We should take treatment integrity data, but in order to meet one of our three goals of the science, we don't actually need to take treatment integrity data. So, though that's important and that's definitely something you should do, it just doesn't relate to the question here. So, if you pick that one, just make sure you're asking yourself what is the question asked. So, what is the actual question asked here? And then next, take operational definition with novel individuals. That would increase your believability. We've already established strong believability, so we actually don't need to do D as well. That leaves us with A as the best choice. So A is the correct answer here. Hypothesize the function of the behavior, because by hypothesizing the function of the behavior, we are making a prediction. We are predicting what the function is, or predicting how often the behavior will happen, or whatever the case is. We are making a prediction. The foundational goals of our science: prediction, description, and control. Control is also known as verification. You might also refer to control as um, verification or control, functional relation. Any of those relate. So, cool. Good. Solid. You receive a referral for a 9-year-old client demonstrating frequent aggression at school when demands are placed. Before scheduling direct observation, you learn that the child has an extensive medical history, including seizure activity. What is the most appropriate next step? A, review all relevant medical and educational records prior to conducting direct observation or initiating assessment procedures. B, conduct observations first to avoid bias from historical information. C, begin developing a behavior intervention plan based upon teacher report alone, that should say. Or D, move forward with direct observation. Sweet. Lots of D's in the chat. I agree. D is the best option. Let's figure out why. So we've done a few things, right? We've done a couple things. Number one, we've identified what behavior we're looking at, aggression. We've also ruled out medical variables, so that's important to remember. So then when I look through the answer choices, if I say A, review all relevant medical and educational records prior to conducting direct observation or initiating assessment procedures. This question indicates that we've already done that because we have learned that the child has an extensive medical history. So A, you can eliminate. B, conduct observations first to avoid bias from historical information. Well, no, you don't conduct your observation before you review records, so get rid of that. Begin developing a behavior intervention plan based upon teacher report alone. We don't want to base these on teacher report. We want to take kind of a holistic approach, and you want to do some combination of direct and indirect. So that leaves us with D, move forward with the direct observation. So we've reviewed our records, we've ruled out our medical variables, and now we want to do some combination of direct and indirect assessment data. This is the next step in that assessment process. This is a section F or a domain F question. So we move forward with direct observation. It could also say move forward with direct and indirect, or it could say move forward with interviews and then observations. Those all would be fine answers. But I had to put alone, report alone on C, because technically you could begin developing intervention plan based upon teacher report, but you really want to go through with direct and indirect assessment data and then hypothesize the function and then go ahead and test the function using an FA. So it's a longer process than just like, hey, the behavior is X maintained. Okay, cool. I'm going to take your word for it and I'm going to target it. Well, no, we don't want to do that. It's a longer process.
Lots of questions
Lots of questions. What's up?
about the medical history component. So if you know that there's a medical component, why are we not covering our bases?
Well, we know there's a medical history component already, but what would we do to cover our basis? We are not going to not serve a client just because they have seizures. All we would do is put a seizure plan into place, which doesn't have anything to do with the direct observation, and none of these options state make a seizure plan. So seizures don't cause a function of behavior. Aggression is not caused by seizures, and if it were, we would have identified that during the medical evaluation. So just because someone has a comorbidity doesn't mean that they're precluded from ABA services. It just means that, hey, I need to make sure I have the medication just in case a seizure arises, or I need to make sure that everyone on the team is comfortable working with an individual that might engage in a seizure. It doesn't mean that I can't move forward. In fact, you would still move forward. And then in the latter steps, you would create like a crisis plan that would be put into place if the client had seizures.
So if you learn that they have a medical history, you don't need to like dive deeper into the records to understand.
Negative. That's outside of our scope. Like I would, so it's a good question. Basically the question, if you didn't hear it, if we learn there's a medical history, do we dive deeper? Not really. Like you're not a doctor. So if someone has seizures, I'm not gonna go, oh, are they, what are the types like clonic and
There's a bunch.
yeah,
Chronic.
clonic. Like we're not gonna go and look at all the different types of seizures. That's not important for me, right? Um, Maybe it's important to the like safety of the client, but it's not important to the intervention that we're selecting. So that's an important thing to remember. And frankly, it doesn't matter in relation to the intervention. It matters certainly based upon the client and the safety procedures, but not to the intervention that we're picking, right?
There's still a lot of confusion.
Okay, where's the confusion?
So just knowing that they have seizures is enough. You don't need to know anything else.
Correct. At this stage, just knowing that there's a comorbidity is enough, right? When you're doing an FA, the reason you find out if there's a medical variable is to determine if the medical variable is causing the behavior, right? If I have a client that engages in ODD, oppositional defiance disorder, and they are diagnosed with oppositional defiance disorder, then I know I shouldn't target task refusal because it's not behavioral. Instead, there's a medical diagnosis causing that behavior to happen. Another example, if I have a client that has cerebral palsy and they struggle with fine motor skills, I'm not then going to target fine motor skills. I'm still going to find the function of the behavior. I'm still going to do direct observation, but I'm not going to then select a intervention or a skill that's incompatible with their medical diagnosis, if that makes sense.
So the details of like precursors to look out for and making sure that you don't do anything to like cause a seizure, does that come later?
Yeah, that's like way later when you're, and that's not necessarily something you would do, right? Like you would get the seizure report form from probably the parent and you would put that in the like medical information section. That's all you would do. And then obviously in real life, you're going to provide training. But as far as like determining the function, there's nothing you would do with that information at this stage.
Okay, lastly, medical and educational records reviews are always the first step, right? So I guess they're asking like you, because you noted that they have a seizure, that's your check off of like records. Is that
Correct.
correct?
Yeah.
Okay.
Because we yeah, exactly. The question basically is how do we know that we've already done the medical history review? And it says you learn that the child has an extensive medical history. Well, how did you learn that? That's telling us that we've reviewed something, and that's what you do prior to moving forward. So here,
Yes.
you have to know your steps. And this is why some of these questions are hard because if you don't know your steps cold, then it's difficult to say, okay, we've learned that. Well, what do we do after? So step one, I'll review these real quick. Step one is you get a referral. And so we do what's called like the preliminary evaluation. This is you're not really reviewing anything, you're just looking at the referral saying, "Oh yeah, this could be a good candidate for services," or "No, we don't meet the requirements for our organization." So it's that preliminary evaluation. The next step is to gain consent to treat. So preliminary evaluation followed up by gaining consent to treat. This is all the paperwork that your clients have to fill out before anything happens. The next step, after you've gotten consent to treat, because you can't review records until you've gotten those consent forms signed, is now you review all relevant records. Those records include medical and non-medical records, educational, medical. It could include records on various different interactions that the individuals have with the environment. That's like that ecological type, but you're reviewing all of those things. After you've reviewed the records, you've ruled out medical variables, and by ruling them out, it doesn't mean like only serving clients that don't have any medical things. It's making sure that we are ruling them out in terms of causing the behavior to occur, causing the behavior to occur. And then from there, you do direct and indirect assessment. So, someone said learn is such a broad term. You could learn from a parental report, which is fine. That means you reviewed the report. So, A doesn't, you already have the information. Doing A is redundant, right? Review all relevant medical and educational records. You have to use the information in the scenario. You learn that the child has extensive. You have to learn this somehow. And at this stage, the way you would learn them, because you have to know the steps, is by reviewing records. You don't do an interview yet. You haven't done an interview yet. Nothing here tells me that we've done the interview. It's actually before scheduling direct observation. And even if you have done an interview, so let's follow that kind of line of thinking. Okay, we've done an interview. Well, D is still your answer because on this test, you go with the assumption, and I know people hate that, but I'm going to say it. You go with the assumption that you follow the appropriate steps unless the question says you didn't. And so, before a direct observation, you might actually have done an interview, but your next step after doing an interview is still D. So it covers all bases. Like A, there's no A cannot be the answer because you've already done that in some respect, whether that be through an interview or whether that be through reviewing the records. You follow the appropriate procedures, and that's how you have to approach the questions on the test. So even if you're saying, "Well, I would do an interview first to learn more about it," cool. We likely have because you learn more about it. So now that still makes D the best choice. Though, when I wrote this question, it's you haven't done that, which is fine, because you could still do direct observation before you do that. Likely you do some combination. The Cooper book doesn't say you have to do one before the other. It says best practice is some combination of direct and indirect assessment.
A lot of people are stuck on like, what if mom told you? So can you just restate that? If
Yeah,
mom tells you, that's okay.
Yeah, if mom tells you that's fine. That means you've done the interview, which means you've already ruled out medical variables because you wouldn't do an interview before you've ruled out medical variables. So if you're stuck on that and you're trying to pick A because you're stuck on mom told you about the seizures, well, then you've done an interview, right? Meaning that you've already ruled out medical variables because that step comes before the interview process. The steps literally, you get the little referral, then you get consent to treat, then you review records, then you conduct direct and indirect assessments. So you would have already done an interview in that assumption. Now I know in real life things are different. Like someone comes into your office and they tell you all these things. I'm not worried about real life. I'm worried about what's going to get you to pass this test.
There were a lot of questions about this question, so can you just, I think I got everything, but just tell them that if I missed anyone to
Yeah,
send it again.
and just remember, slide 15. So we have like seven more questions, and we're not going to take a break because I can already tell this is going to run long. So we have a few more questions, and then what we're going to do is we'll stop for just a second, and then if you need to verbalize your question here, you're more than welcome to do that. Please, though, when you verbalize it, take into account those things I've said. If I need to further explain, that's totally fine. We can do that. So, okay, continuing on. During intake for a 5-year-old diagnosed with ASD, the analyst notes discrepancies between caregiver descriptions of language ability and the speech language evaluation provided by the school district. How should the analyst proceed? A, conduct their own speech language evaluation and utilize information during the goal selection process. B, assume the caregiver's report is more accurate due to daily contact and utilize their information to select intervention goals. C, meet with the caregiver and the speech therapist to develop intervention goals. Or D, request additional documentation to review thoroughly relating to speech language assessments conducted by outside agencies to develop intervention goals. There's been a lot of people that's joined throughout, so just to reiterate kind of the theme or the process, you guys will answer the questions in the chat. You'll answer them to Bree. You can answer to me too, but if you have a question, you need to answer or ask that to Bree because I'm not monitoring for questions. And from there, I'll answer questions obviously at the end of each question, and then if you need to verbalize, meaning speak a question, then just save it for the end of the section, which for this one will be in about 6 more questions, and then we'll go through those then. So, okay, I'm gonna go ahead and answer this one. We do have to increase the pacing just a hair, or else we're not gonna get through all 45 questions. So I apologize. Okay, again, this is a section F question. I guess these last few have been section F. We have an intake that we're doing. We're reviewing these kind of documentation regarding the current skills, right? So you're reviewing basically other assessments to determine what skills we need to work on. But there is a discrepancy between the speech, who is the professional, and the parents, who is the individual caretaker, the one who works with the client every single day. So now we have to determine we've got these two records or these two pieces of information that are conflicting. Now, what do I do? It's not A, right? We're not going to conduct our own speech language evaluation. That's not This is where things get tricky because as a behavior analyst, you should have a pretty firm grasp on speech and language, but like I don't know anything about when certain sounds develop or like oral motor skills that you need beforehand. So we're not going to do that. Fun story. Bree and I started out at a high intensity behavior clinic in Orlando. I used to like name drop because I thought it was really good, but then the owner he got disbarred. So I don't name drop anymore. He was big up at FIT and now he's no longer at BCBA because he's sketchy. Anyhow, that's beside the point. We had a BCBA who we both worked with this little kiddo. He was like 1.5, 2. He was very little, curly hair, remember?
Yeah,
Yeah.
he's like 2.
And they had us doing echoic sounds, and O was one of the sounds, and like he was not getting it for months and months and months. And then we had a friend who was big in speech, and we asked, like, oh, it doesn't develop until you're like 3 or 4. So that's why he wasn't getting it. Huh?
It wasn't, but that's
Oh, it was one of the sounds, whatever the case is. Okay. B, assume the caregiver's report is more accurate. Well, no, it's probably not more accurate because they're not the professional, though I wouldn't say it holds more weight either, but their preferences are more important because they sign off on treatment, so that's a piece of it. But yeah, it's not more accurate. C, meet with the caregiver and the speech therapist to develop intervention goals. I love that. Collaboration. Collaboration is actually required, so we would probably do C. So I'm liking C so far. Um, D, meet with the caregiver and the speech therapist to develop, or sorry, request additional documentation to review thoroughly relating to speech language assessments conducted by outside agencies. There's no mention of outside agencies in this scenario. You'd be adding too much information there. If it said request an outside agency conduct a speech assessment, sure, you can go ahead and refer them to another speech language person, and I would be okay with that. But it says review documentation relating to outside agencies. That hasn't been done, nor have you made a referral to that. And you can make a referral, that's fine. But you haven't done that here. And so C is the best answer. C fits in the spirit of collaboration. Make sure that you're working with the family to determine what the best way to go is, and work with the speech too. Like your job is to take the best of both worlds and make an intervention plan that truly helps the individual. Cool. All right. Not a lot of dissension there. Okay, so here we go. You have been offered a position at Lions Pride ABA Incorporated. After providing appropriate notice to your current organization, you begin your role at the new organization. You are given a caseload of 3 clients that are currently being supported by the clinical director. How might you initiate supporting these clients? A, set up a transition plan with the clinical director to review current interventions and protocols. B, read a recapitulation of client treatment plans. C, request that you are able to observe the clients during overlapping supervision sessions with the clinical director. Or D, schedule meetings with the caregivers to evaluate their goals and objectives for services. All right, let's look at the answer here. And so a couple things, right? We know that they cannot complete multi-step independent tasks. So what might we do to help them do that? Let's look at our answer choices. A, conduct a task analysis assessment across job-related routines to evaluate independent sequencing and problem-solving skills. So that seems like we would make the TA, which is good because if we have a client that can't follow multi-step independent tasks, then we can create a TA and then select a chaining method to then teach it. So I like A. How about B? Focus on preference assessment data to increase motivation during work sessions. Well, it doesn't seem like the issue here is motivation. Nothing in the question relates to that. Reinforcement is good, but if we currently cannot complete multi-step tasks, adding reinforcement won't solve the problem, right? You have to teach before you reinforce. And then there's no reason to do C or D. If you're saying you should do D to determine if it's a task that they should do or shouldn't do, I see where you're coming from, but that's irrelevant because it's a vocational program, so it's the requirement of the job. And thus, if you're in this vocational program, you have to complete the job. We wouldn't change the job based upon the normative reference, right? It's an adult, likely most of the skills would fall in that category. So A is the best answer here. Conduct a task analysis assessment. Basically, you're just creating the TA to determine what steps you would then implement to, create the TA to then determine what chaining method you would utilize to then teach the multi-step task. So cool. Nice job. That is probably F as well. You are assigned to reassess. These are a lot of F for this section. So I'm sorry about that. I don't know why. You are assigned to reassess a client who made substantial progress across communication and social domains. The caregiver reports new difficulties with tolerance for denied access. What is the best next step? A, regain consent to treat. B, repeat the entire initial assessment. C, conduct a new FA, or D, modify the intervention to account for the new challenges that have been reported. All right. So lots of C's and some D's in the chat on this one, and I agree. C is the best answer. I mean, C is the best answer. Why is C the best answer? Well, we have a new difficulty with tolerance for denied access. So this is new, telling us it hasn't happened before. Since it's new and it hasn't happened before, that means that we would need to conduct an FA to determine why it's occurring. Let's go ahead and find the function so we can appropriately address that, right? So conduct the new FA, find the function, appropriately address it. We're not going to regain consent to treat. You already have consent to treat. You don't need to regain that. If you're going to implement a punishment procedure, you might need to get consent to do the punishment procedure, but we don't need to regain consent to treat. B, repeat the entire initial assessment. You don't need to do the entire initial assessment again, right? Like we don't do all the steps of an initial. Anyways, it would be a reassessment. So B doesn't work. And then D, modify the intervention to account for the new challenges that may have or that have been reported. Um, you are going to modify. So you will do D, but first you would conduct a new FA to determine the function. So it's just the process, right? It's like the order of operations. What do you do first? Which leads us to what you might do next. The first thing that you need to do is conduct a new FA. From there, then you can modify the intervention with that information. So someone said, do we need consent for a new FA? Well, no, you already have consent to treat. You need consent if you're going to implement a punishment procedure, but you don't need new consent forms or anything like that. So solid. All right. You review narrative recording data indicating that attention was missing prior to 70% of problem behavior. You utilize this data to outline the conditional probability of the behavior occurring given these conditions. Based on the information in the scenario, you have likely A, conducted an indirect assessment, B, conducted ABC narrative recording, C, conducted continuous recording, or D, conducted a direct assessment. All right, best answer here. So, a few things, right? So, you have likely. So, what have we done in this question? Well, number one, conditional probability is a giveaway. So, this is an associated term. And then also, this attention was missing prior to 70% of the problem behavior. So, that means we know when the behavior occurred and when the behavior didn't occur. But, conditional probability is under this set of conditions, the behavior is X likely to happen, meaning you need to know when the behavior occurred and when it doesn't occur, right? So that's your giveaway. This is going to be C, conducted ABC continuous recording. ABC continuous recording allows us to see when the behavior uh, occurs, the direct antecedents, but also when the behavior doesn't occur. So if a common antecedent is, let's say, a demand being placed, we would mark that even if the behavior does not occur. That's the only way we can assess conditional probability. Whereas ABC narrative recording is only recording the behavior when it occurs. It's not, only recording antecedents and consequences when the behavior occurs. It's not recording them all the time or common antecedents or common consequences. So that is that. Yeah. Okay, cool. A, conduct an indirect assessment. You might have, but again, remember, you don't have to conduct indirect. So best practice is some combination of direct and indirect, but based on the information in this scenario, we know that you've done ABC continuous because we're doing conditional probability. From there, D, conduct a direct assessment. We have conducted a direct assessment. So D is not a wrong answer, but you always pick the most specific answer. Most specific answer. So you've conducted ABC continuous recording. Um, Someone said, why does it say narrative recording at the beginning? Remember, ABC recording is called narrative recording. Within narrative recording, you have ABC continuous and you have ABC narrative. So it's a category that includes ABC narrative and then ABC continuous. So good question. Cool. Anything on your side?
The informing is indirect since you are reviewing.
Huh?
I'm not sure what that's.
Okay, we'll answer it later. If you're raising your hand, we'll answer those at the end. So if you don't mind typing your questions, we're not at the end yet. And then at the end, we will go ahead and let people ask questions. Just remember the slide number, please. Is ABC continuous the only one that can give conditional probability? As far as between ABC narrative and ABC continuous, yes, because ABC continuous, because ABC continuous tells us when problem behaviors occur, but also when they don't occur. So it gives you both of those things. So that's why that one is important. Does that make sense? Cool. I hope so. All right, let's go ahead and move to the next one. So let's move over here. Uh, During ABC narrative observation, the BCBA notices that transitions often precede tantrums, but sometimes tantrums only occur during play. What is the most appropriate next step in evaluating the data? A, conduct a scatter plot to determine when the behavior is occurring and then schedule a direct observation. B, conduct indirect assessment procedures to confirm these findings. C, conduct a formal FA based on the hypothesis. Or D, create an interview based on the hypothesis. Go ahead and throw your answers in the chat. All right, so let's go ahead and figure out what the answer is. Okay, so you've done ABC narrative already. So we've done a direct observation. So a lot of you picked A, conduct scatter plot to determine when the behavior is occurring and then schedule direct observation. You've already done a direct observation because we've done ABC narrative. ABC narrative falls under the direct observation category. So you don't need to do A, y'all, right? Because we've already done it. B, conduct indirect assessment procedures to confirm these findings. You probably should conduct indirect assessments, but it's not going to confirm the findings. The wording matters on these questions, so the wording does matter. So B is not the answer because it's not going to confirm your findings. C, conduct a formal FA based on the hypothesis. I like that. Likely would want to conduct a formal FA because that will test your hypothesis and give you a definitive function of the behavior. So A is or C is a good answer. D, create an intervention based on the hypothesis. So in real life, probably D is what you do, right? Like we don't always do FAs. In fact, we do FAs very infrequently in real life. But on the test, the FA is the gold standard. So we need to do an FA. So that makes C the best option here. Again, you've already done A because you've done a direct observation. If this just said conduct a scatter plot to determine the best time to conduct an FA, maybe that's a good one. But usually FAs are across multiple sessions. Standard FAs can take up to a week because you want to get them in various different situations and settings. So you really don't need to do a scatter plot in order to determine when to do the FA because the FA is you're kind of contriving the situation anyways. So it doesn't matter when the behavior typically happens in an FA. And second to that, right? Because lots of people picked A, you've already done a direct observation. ABC narrative is a direct observation. You usually are doing a scatter plot before you do your ABC data collection. So that way, when you go in and you do your ABC data collection, you're actually seeing the behavior occur. So hope that makes sense. All right. Prompt fading in a skill acquisition program has not been implemented on 60% of trials according to your integrity data. Two RBTs rotate, and only one appears to fade prompts properly. Skill acquisition has plateaued. What is the best decision? The best decision. A, provide corrective feedback and targeted training to both RBTs. B, provide training to the RBT who has demonstrated a low level of fidelity. C, provide additional resources to the environment and increase the motivation of the RBTs to properly implement the procedure. Or D, modify the intervention, eliminating specific steps to make it easier to implement. All right, I'm gonna go ahead and explain it. Full disclosure, this I made a mistake here, so I messed up. I rewrote the question, and in the rewrite, you'll see on the next slide. I took out low, and it just says demonstrated fidelity. Obviously, if you demonstrated fidelity, then you don't pick B. Lots of you pick B, and based on the way the question's written, I think B is the best answer. So I'm not gonna go to the next slide because the next slide I have the wrong answer highlighted because again I changed it on one slide and not the other. My mistake. So as written, B is the best answer. Provide training to the RBT who demonstrated a low level of fidelity. But there's some caveats here that I want to explain very clearly. So first and foremost, let's look at A. Provide corrective feedback and targeted training to both RBTs. Sure, A is great. You should provide corrective feedback. You should provide targeted training to both RBTs, but it doesn't really address what's happening here, right? So, like, clearly there is a lack of treatment integrity with one person. Treatment integrity, how the intervention is being implemented, skill acquisition for the client has plateaued. So, something has to change. B is the best choice given the options. I don't love B though, because you need to find out why. Like, why has the person not been implemented the procedure? So that's why I really would want some answer in here that says, like, observe the implementation to determine the contingencies governing it, or something along those lines is what I would want to see. It's not here, and that's why these best questions suck. Like, you have to pick the best one given the options, and B is best. It doesn't really work, but it's the best one. And that's why I rewrote it. Full disclosure. Okay, C, add additional reinforcers. Well, is it reinforcement? Is it motivation? I don't know. You could try that. It probably won't work. It might work, but you never know. D, modify the intervention, eliminating specific steps to make it easier to implement. D might also be great, but in order to do D, we need to make sure that that's appropriate for the client. So if it said, what is the uh, most best decision given all options work, then I would pick D because it's the parsimonious answer. It's the thing that's simplest. It's the thing that's easiest, but it's not one of the choices. So B is the one I like best here, though I don't love any of these. And I want you to remember that you need to make sure that you're like treating this like a client, figure out why they're not implementing the procedure, and then move on from there. So just a caveat. All right, two more, and then we'll take a couple questions, and then we're gonna keep rolling because we're like half hour behind schedule. So during weekly fidelity checks of FCT programming, you notice that caregivers frequently omit the extinction component, providing escape when the target behavior occurs. What should you do? A, provide direct and immediate feedback followed by a behavioral based interview. B, provide praise for portions of the plan that are implemented appropriately, followed by modifications to the portions that are implemented incorrectly. C, request the caregiver observe a center-based session while implementation of the procedure is occurring. Or D, utilize BST in combination with positive reinforcement to help establish the implementation of the procedure. All right. Lots of varied answers here. This is a tricky question because it's a caregiver, but honestly, I don't want you to treat it any differently than if it was not a caregiver and if it was simply a supervisee. So if you change out caregiver and it was supervisee, you'd probably pick A. And because it is a caregiver, you still want to pick A. So provide direct and immediate feedback, followed by a behavioral-based interview. You should always be providing direct and immediate feedback. Feedback is not a bad thing, and just because it's direct doesn't mean it's mean or rude or whatever. It's constructive. Direct just means to the point. And then immediate, obviously, feedback should be immediate, followed by a behavioral-based interview to determine why they're not implementing the procedure as written. Then we might make modifications. But feedback should be immediate. Someone said, why is doing it immediately the right thing to do? Well, because number one, in the Supervisor Training Curriculum 2.0 that the BACB released, they state in there, it says feedback should be delivered immediately. And then in the Supervisor's Guidebook, which is one of the foundational material for supervision, it also states feedback should be immediate. You're so welcome. Okay, so that's why that is. Lots of you pick B though, so let's talk about why B doesn't work. Provide praise for portions of the plan that are implemented appropriately. I like that. I love that. You should definitely do that. Followed by modifications to the portions that are implemented incorrectly. I might not need to do that. Maybe you need to do modifications. Maybe you don't. But regardless, you need to provide feedback. So you're missing the whole feedback point with B. And I feel like this happens a lot in our field. We focus on what you're doing good, which is great, but sometimes we have hesitations when giving you that direct feedback. And we need to change the culture. Feedback's not bad, y'all, right? Like if you've played sports, you probably get this, and I would say this is probably where like 90% of Bree and I's marital Bree calls them arguments, I call them communication, occurs because I played sports and she might not have. And so feedback is a good thing. And if you played sports, you probably get that. But we don't want to just focus on the positive things. You gotta focus on all portions of it. C, request the caregivers observe a center-based session while implementation of the procedure is occurring. You probably should have done that prior to doing fidelity checklists with caregivers. Like you should have given them all opportunities to learn it, just like you should have done D before you jump in with caregivers. So you probably or you should have already done C and D, making them irrelevant to the question. You're not doing weekly fidelity checklists unless you've trained someone on how to implement the procedure. So C and D don't work, making A the best answer.
There's a couple people confused. They're being thrown off by the behavioral based interview part.
Behavioral based interview just means we're asking questions just like we would with if we're determining the function of a behavior for a client. Behavioral based interview means that you're not asking why. It means you're asking, what's happening before the behavior occurs. These are the interviews that your BCBA is doing. These are intake interviews. We just call them behavioral based so that way you're not asking, hey, why do you think Johnny hit you? Like we don't ask that. It's not a behavioral based question. Solid. All right, last one in this question set, and then maybe we'll risk it and try to take a few vocal questions. I don't know yet. You suspect the therapist working with your client has deviated from the treatment plan. You would like to confirm this in your next oversight session. Which of the following would not be an appropriate way to accomplish your goal? A, observe and record data. B, interview the therapist regarding implementation of the procedure. C, conduct IOA data during a session. Or D, review video recordings of recent sessions. All right, let's do it. Lots of B's and C's and A's, a little bit of everything here, but okay. So you suspect they've deviated from the treatment plan. This tells us that we have a treatment integrity issue. How can we, how should we not accomplish our goal? So how can we not confirm if it's treatment integrity? So this is a reverse question. It's a negation question. So could you observe and record data? to determine if there's a treatment integrity issue? Yes, you could. So A is good. Could you interview the therapist regarding implementation of the procedure? Maybe. This is indirect, so it's not as good as direct. So I would, this is a hard maybe. I don't love it, but it could help you determine the implementation of the procedure because you could ask, how are you implementing it? Again, not a great way to do it, but it's a solid maybe. C, conduct IOA data during a session. IOA does not go with treatment integrity. So this is a no for me. Or as Randy would say, that's a no dog. And then D, that's Randy from American Idol.
Yeah.
Yeah. Okay, D, review video recordings of recent sessions. I also like D. D is direct, so D is better than B, but C is a no. C is a no. IOA and treatment integrity do not go together. I want to be very clear. IOA comes in section C, which is measurement. IOA is how much of the behavior is occurring. So how much of aggression is occurring, how much of elopement is occurring, how much spontaneous manding is occurring. It has nothing to do with how the intervention is being implemented. Now, if you pick B, I'm there with you. Like I would not do B in real life, but you could do B. The data's not gonna be great. Data's not gonna be super believable, but you definitely can't do IOA. So C is the not. B is a close second because I don't love it and it's gonna produce bad data. But you could do it, right? It's an indirect assessment, and you can do indirect assessment, so that's fine. But you certainly can't do IOA. IOA goes with section C, which is measurement. Treatment integrity goes with section H, which is implementation, or domain H, which is implementation of the intervention. Wow. That is the longest set I've ever done. I usually run an hour a set, like never fails. I'm on it, but these questions are a little bit longer, or I'm getting old. I don't know which one. Okay, let's go ahead. We'll take a couple questions so you can hit the little hand thing and then I can answer them. So first, can you explain the difference between treatment integrity and fidelity? I can. There's no real difference. The Cooper book states that these can be used interchangeably. However, treatment integrity most specifically refers to how an intervention is being implemented, whereas procedural fidelity refers to all phases of an experiment. So theoretically speaking, fidelity goes with like EAB, whereas treatment integrity goes with behavior service delivery. So that's the slight difference.
Um, on the previous question, why wouldn't you conduct IOA? Wouldn't that help confirm if the therapist is implementing the treatment plan correctly?
No, remember, IOA has nothing. IOA is just a number. We get a number of how often the behavior occurs, and are we both measuring it the same? It has absolutely zero to do with the implementation of the intervention. IOA is about amount of behavior, not implementation of procedure. Whenever there's a new behavior, do we need to conduct a new FA? Yes, if there's a new behavior, you need to conduct a new FA because how would you be able to how would you, how would you be able, sorry, I'm laughing because there's a different question, but how would you be able to determine what the function is and how to intervene? So you have to do an FA. If you have like a question, like someone like copied and pasted a like physical question from someone else here, and I'm happy to answer those, just not today. So email that to me and I can help with that. The questions today, if you don't mind, just have them relate to procedures that we're reviewing, but you can email that to us. Yeah, no problem, no problem. IOA helps with observer drift. Yes, IOA helps with observer drift. And Bree will put our email on the chat so that way you all have it if you don't mind.
Can you explain the demonstration of experimental slash functional control? We'll
Yeah, they can email that one too. Okay, cool. So no one needs to ask a vocal question, right? Just giving you the chance.
Confirming your previous thing, were they confusing IOA with fidelity?
Yeah, you probably were confusing those.
Yes, I would like to go back to slide 15, where there was like some disagreement about whether the medical records were reviewed. The way I read the question, like, sometimes just during intake, the mom will say, "Hey, my kid has seizure," which could be during the consent when they're signing the
Does
paper.
the
It could be
does
just,
the does the question say that though?
but the question also does not say that we have reviewed medical records. That's an assumption too. And that's why I was just trying to follow the sequence that the medical record reviews comes before we do the direct and indirect.
But on the test, right? So you're following, again, we have to go black and white with what the textbook says. You're adding information. I agree with you. A lot of times you'll get excess information during the initial, like receiving the referral, but you shouldn't because the referral is a piece of paper. You're not talking to anyone when you review the piece of paper. Same thing, the consent form is a piece of paper. You're not talking to anyone when you're getting the piece of paper. Then you rule out medical variables. So if you're assuming that you're talking to them, then you have to assume that that takes place during the interview process, which means you've already done A.
So interviewing the parent is not the same as reviewing the medical records, and that's where I'm confused. So we learned that the client has seizure. I agree with that part. We already know one big medical variable, which is very important for this client's behavior. I get that. However, that could be as simple as when the mom came in, just so you know that my kid has seizure, but like that does not relieve us of our obligation to review the records. So I'm following the sequence you gave us. One is first is referral review or preliminary eval, followed by consent to treat or paperwork. Then comes the records review. But this mom could have just blurted out in step one and two. How can we
That
assume?
that's not typical, right? That if you learn something, you follow how would you have learned it as an ethical analyst? As an ethical analyst, you would have reviewed the information available to you to learn that. It doesn't say like if we're going with assumptions, then it would give you the information that in passing someone mentioned a seizure. And then you can go ahead and go with that analysis. Otherwise, you follow the typical procedure. Typical procedure is not in passing. Really, there's no if you're following the actual procedures laid out in the like text, there's no opportunities for that. You get the referral. From there, you get consent to treat. From there,
Mhm.
you rule out medical variables. You very well could do that during an interview, but we don't go with that analysis or assumption because typically we do that by reviewing the paperwork that they submit from their like initial intake assessment data. Then you go into your interview. But again, like a we're saying if you've learned this because it says you learned it, that's actually important. I know it threw a lot of people off, but how can you learn an extensive medical history, including seizures? It doesn't say you learned just about seizures. It says you've learned an extensive medical history. How can you gather that just from passing? You know what I mean?
So just the mom or dad or even like this teacher could say, just so you know, this cat has extensive medical history, including seizure, and that's another reason for us to go back and look in the records because when there's one comorbidity, there could be
But
more.
what I'm saying is there's no opportunity for number one, there's no opportunity for passing. Like you're implying that or you're assuming that. If you followed the opportunity, there would be no opportunity for that. The other thing though, extensive medical history, it's telling you you know that there's a lot of things going on. You're not going to gather that. Like it's very unlikely that someone is going to pass you and say, "Hey, this client has an extensive medical history of seizures," and then you're just going to move forward. Like that is atypical. And so you want to go with what is typical for the situation and typical for the test. I would really, for you, I would really recommend a tutoring session because I do notice a theme when you approach the questions, you're adding information
Mhm.
based on your experiences and not based upon like what the text would have you do. And we need to get your framework of thinking onto don't worry about what happens in real life, worry about what would happen on the test because a lot of the test questions are like what is the next step, which means you have done X, Y, and Z steps, and the question needs to tell you what are the steps you've already followed. And so I had to put that in there to show you you've already done that step. Does that make sense?
So yeah, the keyword here is extensive medical history. If the extensive medical history was not
No,
there,
even if it said seizure activity, that's enough because you've learned it. And if you follow those steps, the way you would learn it is through the medical review. That's the only way you would learn it based upon the steps of the assessment process.
so we just assume that they're just ideally following things in a structured manner,
Correct.
even
You
though things are
100%.
chaotic in the real world.
We don't worry about the real world though. The test is very clinical. The test is very specific based upon the textbook. If we worried about the real world, no one would ever pass because there's too many variables that occur in the real world. So the test can't be based upon that. The test is based upon the Cooper book and the specific procedures. And you always, every single question you approach, you have to approach them initially with the assumption that you are an ethical analyst, meaning you followed the appropriate steps, unless the question says otherwise. And that's a big unless.
Thank you. So another question I have is from slide 25.
Real quick, though, I'm going to go to a couple other people, and then if we have time, I'll come back over to
Okay,
you.
no problem, no problem.
Okay,
Thank
cool.
you.
Yep.
Hi, so I'm not gonna lie. Um, this question actually got me really, really riled up because I was really focusing on the before direct observation. But then I learned that reviewing a record doesn't necessarily have to be like I'm reading, like I'm doing direct. It could also be an indirect, like just interviewing parents or just because that's the only thing that got me confused here.
Yeah,
So
theoretically speaking, the record review shouldn't come from the interview. The record review should be its own thing. And so, in this question specifically, you've received a referral. That's telling you your first step. You know that the client demonstrates frequent aggression when demands are placed. So we even know when the behavior is occurring. So this is telling us, right, that you've reviewed some information because not only do you know the age, not only do you know the behavior, you know when the behavior is happening. This is all information telling you what steps you've already completed. So now it says before scheduling direct observation. So this tells me I have not completed direct observation, right? That's one of the steps of the assessment process. It says before scheduling direct observation, you learn that the client has an extensive medical history. Cool. So we would have learned that before direct observation if we reviewed records. We would have learned that before direct observation if we did an interview. So those are all things that might have happened, right? So this is like your framework. Then it says what's the appropriate next step. So A, we don't need to do that because you've already done it. B, conduct observations first to avoid bias. Well, no, because it says you're doing observations next, so B doesn't matter. C, begin developing the intervention plan based upon teacher report. Well, number one, there's no teacher here. Oh, it does say at school, so maybe there's a teacher. But this would be an interview, and we don't develop the plan based upon the interview. It could have very well said begin by interviewing the teacher, and then that would be a correct answer, possibly. But I can't give you two correct answers, right? So like it's very intentional how these questions are written. We're giving you enough information to answer it, but not too much information. You still have to sort through it. And then D, move forward with the direct observation. Basically, nothing here is ruling out moving forward with ABA services is what this is saying. Like, okay, cool, you have seizures or other medical variables. It doesn't say that they're impacting or causing aggression. If you found that the behavior is linked to the medical variable, then you wouldn't move forward. And that's really all you're worried about. Does that make sense?
yeah, so my real question is about the stimulus control. I think it's like the first or the second question. It said the stimulus control is also is it can also be attributed to measurable dimension
Correct.
because before I used to think stimulus control is just basically reinforcement and punishment. So well, I don't really understand that phrase, measurable dimension. What does that really mean when it comes to stimulus control?
Well, stimulus control means something causes a behavior to happen. It doesn't necessarily relate to reinforcement or punishment. Stimulus discrimination is developed through reinforcement and punishment. Stimulus control just means that this causes that to happen. A stimulus is controlling the behavior. The direct quote from the Cooper book, it says that stimulus control is also or can also be attributed to a change in the measurable dimension. There's three measurable dimensions of behavior: repeatability, temporal extent, and temporal locus. So if one of those measurable dimensions, rate, frequency, duration, IRT, latency, if one of those measurable dimensions changes, we can still say that stimulus control is occurring. So I hope that makes sense.
Yeah, and what's the difference between stimulus control and stimulus discrimination?
Stimulus control just means the stimulus controls the behavior. Stimulus discrimination is responding differently under a specified set of antecedents. So stopping at a red light and going when it's green. That's discrimination. Stimulus control is the red light causes the behavior to happen. So the red light causes you to stop. It only becomes discrimination when you respond differently. That's what the like textbook definition is.
Now I can.
Yeah, for sure.
Okay. Hi. So I have a question on number 25. Let me pull up.
Yeah, I can go to it. Question, slide 25?
Yes.
Okay.
Since it says that you are reviewing a narrative recording, is that you? I interpret that as you aren't directly looking at or taking the data yourself. It could be either the RBT. So and the question is asking based on the information in the scenario, you have likely I would interpret it as you're looking at that data is indirect because you aren't directly taking that data.
Remember, if you go and you look at a like someone's worksheet after it's completed, it's a permanent product, but it's also considered a direct measurement of the behavior because it's that measurement directly counted the behavior when it happened. So just because you're reviewing it after, like if I review the results of an FA, the FA was still a direct assessment. Reviewing the results of an FA is not an indirect assessment. It's still direct. Does that make sense?
Yeah, I think I was just taking it as if the data was recorded by a non-professional.
Even if, yeah, even if it is though, even if it is, if it's a specific behavioral procedure, number one, right, we wouldn't have allowed someone who wasn't trained to complete narrative recording because that's a specific behavioral procedure. And then number two, unless the question says that, right? So just don't add that little piece, okay?
Okay, yeah,
Sweet.
that makes sense.
Okay, cool. All right, let's go to the next section. I know there's probably people dying with questions, and this is gonna be one of those ones where you're probably gonna have to email me. We were definitely will get through set two. I don't know how far we're gonna get into set three. Hopefully, we can get through a lot, but let's roll. I'm gonna go at a quicker pace. I know some people get frustrated when I do that, and I apologize. I'm just trying to present as many questions as possible in a way that you still explain them. So if I go too fast, let me know. I would rather do less questions and have you understand them than get through all of them. I can always circle back, right? So, all right. I'm gonna give you a little bit longer on this one because frankly, I have to use the restroom real quick. So let's read this one. And I'm gonna let you read it, and then I'll read it when I get back. All right, let's read it, and then I'm going to go directly into the answer. A study was implemented to look at ways to increase seatbelt usage on college campuses. The study found that utilizing antecedent interventions such as signage and prompts were more effective than utilizing fines. Based on this, we can say A, the results of the study should be similar at colleges across the country. B, seatbelt usage increased with each participant. C, signage was more effective than utilizing prompts. Or D, seatbelt usage was low for each participant prior to the implementation of the intervention. Number one, you have to identify this is a group design, right? So the study, seatbelt usage across college campuses. So we're looking at a group design here. This is what makes it tricky, right? The study found utilizing antecedent interventions such as signage and prompts were more effective than utilizing fines. So like C could be correct, but what can we definitively say And I actually might change this because if you pick C, you're also right. So I like C. Signage was more effective than utilizing prompts. Such as signage and prompts were more effective. Oh, never mind. Signage and prompts were more effective than fines. I'm moving too quickly. So C is not correct. Signage was more effective than utilizing prompts. Signage and prompts were done together, right? So all we can say is A. All we can say is A. I'm glad someone else moved too fast too. Okay, so A is the right answer here. This results of the study should be similar across college campuses. Yeah, A, when we have a group design, and you might say, well, how do we know it's a group design? Y'all, in order to do a study across college campuses, it has to be a group design. It's the only feasible type of design study. And so when we have these group designs, we cannot analyze individual variability. So B is ruled out and D is ruled out. We cannot say anything in relation to individual data. All we know is the group data. The other thing that we know is that group design data are typically generalizable across other groups. Now, similar cultural variables need to be in play, but when you take the data from a group, and this is how like organizational behavior management works, if I take the data from one company, I can say that that intervention is likely to be effective at similar companies. Same thing here. This intervention, since it was done on college campuses, should be effective across other college campuses. Group designs are not used very frequently, but when they are, the only thing we can say is that their data are generalizable to other groups. We cannot determine individual data or individual variances within data.
Choice D would be a single case design, correct?
Yeah. All right, continuing on. I'm only going to give you about 30 seconds on this one. The Seahawks implemented a 5-minute pre-practice stretch in order to decrease hamstring strains. The IV, in this case, the Seahawks. The pre-practice stretch, hamstring strains, or behavior reduction. All right, that was longer than 30 seconds, but I have to plug the computer. Bree's computer died. Definitely find me under the table. Okay, well, the answer here, is it charging? Okay, the answer here is B, the pre-practice stretch. The independent variable is the intervention. That's what we are manipulating to see if it causes a change. In the dependent variable, the dependent variable in this case would be hamstring stretches. So there you have that. Yeah, the dependent variable is the behavior. The independent variable is the intervention. Frank and Greta conducted an investigation examining the effects of systematic desensitization procedure on the acquisition of tolerance of haircuts. The intervention was implemented within the clinic's barbershop simulation environment. Following several weeks of graduated exposure, the client successfully tolerated contact with electric clippers on the scalp. During the subsequent session, a student barber entered the clinic and the client permitted the full haircut without the emergence of maladaptive responding, which is exemplified in this scenario. A, response generalization, B, stimulus generalization, C, internal validity, or D, external validity. All right, you guys are gonna hate me on this one, and I'm so sorry. I'm gonna apologize in advance. And there might be some dissension here, but okay,
Sorry.
we're gonna rule. Oh, okay, I got you. You have to rule out A and B, y'all. Lots of people are picking these, but tolerating a haircut technically doesn't fit the dead body test, right? So we don't have stimulus or response generalization because again, the behaviors, right? So like the response tolerating, is that a behavior? Probably not. So if I could cut a dead body's hair, then response generalization wouldn't work or stimulus generalization wouldn't work because it theoretically it would be stimulus generalization because a new stimulus is coming into the environment, though it doesn't necessarily pass the dead test. So B, I like that. Someone said, then what's maladaptive responding? Well, there was no maladaptive responding, so it didn't happen. Therefore, there's no behavior, right? So I covered that basis as well, luckily. So instead, the best answer here, there's a solid argument for B, so don't get me wrong. But like if we're looking with a fine-tooth comb, C is a little bit better because it's the same intervention and the same result. No responding, right? Intervention didn't change. A new person is there, but we didn't change the intervention. External validity would happen if I use this on a different person, not if a different person is giving the haircut, right? So like that's the difference between internal and external validity. Internal validity, same intervention, could be different people implementing the intervention, but it has to be with a different person, with a different behavior, or in a different setting potentially. So that would be internal validity or external validity if those things occurred. Now, for those of you that picked B, again, probably fine with that. Likely you're not going to get a question this hard on the test. I just want to show you this is like one of those questions we write in order to have a teaching point. You're not going to get one that's this hard. We don't even put them that are this hard on our actual mock exams because this is one that I can verbally explain to you. Probably stimulus generalization is totally fine. But again, in order for us to fit stimulus generalization, this is responding the same under a certain set of antecedent conditions. Well, there was no responding. So theoretically, you're not responding the same because no responding is not a behavior. Therefore, it doesn't really meet the definition of stimulus generalization. I know, y'all probably hate me for that, but I hope that makes sense because again, it's the absence of behavior. The absence of behavior is not behavior. It doesn't pass the dead test. So, does that make sense? I hope so. You're welcome. I know it's a hard question. And again, probably harder than you're going to see on the exam, harder than you'd likely see on our mock exams. But I just want to be very clear. If this were like they said thank you after, then cool. It's definitely stimulus generalization because saying thank you is a behavior. But tolerating is not a behavior. So just wanted to make that point. Real quick, the difference between internal and external validity. Internal validity, same intervention, nothing changes, same results. So here the intervention is haircut, and then we just did it again, and same results, no responding. So theoretically, you do have the same response, or a lack of response, I should say. Then with D, external validity, now you take the intervention and you implement it with a different person. So not the barber, but the person getting their haircut. Or you implement it in a different setting. So not at the clinic barbershop, but at the client's home. Or you implement it with a different behavior. So not only did you tolerate haircuts using this, but now you tolerate getting your fingernails clipped using this. That would be external validity. Cool. All right. That was a hard one. The main goal of the science of behavior analysis is to develop a functional relation. This allows you to be certain that it is our intervention modifying the behavior and not some other factor. When systematically increasing the amount of time that the learner sits in a chair, we can achieve this highest level of our science by A, producing a return to baseline levels by re-implementing the intervention, B, keeping tier 2 and 3 baseline data unchanged until the intervention is introduced. C, looking at the distance between each intervention being tested. Or D, by reducing the reinforcement criteria from one phase and then continuing to increase it. All right. So number one, you have to figure out, this is a experimental design question if you haven't identified, likely you have. We have to figure out, well, what type of design is being used? Well, let's look at it. You're systematically increasing the amount of time a learner sits in their chair. So A, return to baseline, this would be a reversal design. Well, sitting in your chair is an irreversible behavior, meaning I can't use a reversal design. So not A. Also, this word, when systematically increasing the amount of time, that's used with a different design. We don't systematically increase the amount of time with a reversal design. We implement the procedure to see if there's an increase. We don't systematically increase it. So it's not A. B is a multiple baseline design. Here we don't have a multiple baseline, so that doesn't work. So get rid of B. C, looking at the distance between each intervention. We don't have different interventions. We have different amounts of time, different requirements. That means we're using a changing criterion, which leads us with D. D is what we call a bi-directional change. You reduce the criteria to a different or to a previous level in order to see if the behavior conforms with that level. If the behavior goes down to that previous criteria change, then it is our behavior that's causing it to change, not, or sorry, then it is our intervention causing it to change, no other variable. Again, this is called a bidirectional change, and it's only used with a changing criterion design. With changing criterion designs, the behavior has to be in your repertoire. So, sitting in your chair has to be in your repertoire, and we only use it to increase or decrease amounts of behavior. We don't use it to change what the behavior looks like. We don't use it for behaviors that aren't in your repertoire. You have to have the behavior in your repertoire, and we only use it to increase or decrease behavior. All right. You design a comprehensive intervention intended to shape manding behavior from single word requests to complex multi-word utterances consisting of 3 to 5 words. The plan is meticulously constructed with explicit procedural steps reviewed in detail with both caregivers and behavior techs assigned to the case. As antecedent manipulations, you incorporate a social story and a weighted blanket to attenuate disruptive sensory seeking topographies and promote behavioral regulation. You conduct frequent data reviews to evaluate procedural integrity and implement data-based modifications as necessary. Despite the systematic and conceptual coherent design, the plan fails to account for A, the technological dimension, B, the conceptually systematic dimension, C, the behavioral dimension, or D, the applied dimension. All right. So the best answer here is B. B is the best answer here. Weighted blankets doesn't have empirical support. It's not reinforcement, it's not punishment. It doesn't meet conceptually systematic. We meet technological because you have the meticulous plan, so that's good. Technological, written in a way that others can implement it. We have behavioral. It's, multi-word utterances, 3 to 5 words. So we can definitely measure that. You can observe it. Applied isn't meaningful. Yes, manding is meaningful, but you're using social stories and weighted blankets. Fun fact, a lot of you probably use social stories. I have too. They don't have any scientific evidence in terms of behavior analysis, as well as weighted blankets. They have certainly a sensory and OT piece to it, but there's no current research that supports social stories or weighted blankets. So, honestly, you should probably leave those out of your plans. Whether you use them or not, I would not put them in your plan. So, all right, conceptually systematic using the principles of behavior reinforcement. punishment, and extinction, and any procedure derived from those. Next one. Recent claims have asserted that prenatal exposure to acetaminophen increases the likelihood of autism spectrum disorder in offspring. Some correlation data indicate that as maternal acetaminophen usage rises, the reported incidence of autism also increases. However, these findings fail to adequately control for potential confounding variables such as genetic predisposition and sibling concordance rates. The initial claim seems to closely align with prediction, description, control, or hypothetical constructs. So the first question to ask yourself is, what is the initial claim? Well, the initial claim is that acetaminophen usage increases the likelihood of ASD. So that's the initial claim. Now, the initial claim most closely aligns with what? Well, that's a prediction, y'all, right? So we are predicting that if you take acetaminophen, your child will have autism, right? It's a prediction. It's not description. It's not describing the behaviors associated with it. Description would be taking 50 milligrams of this, or taking 60 milligrams of that, or taking whatever. Description is describing what the behavior looks like. In fact, the only thing we know about the behavior here is that it's taking acetaminophen. There was no like amount. There was no when you take it. There was no if you fail to take it. Description would be talking about like specifically how you take it, the amount you take it, blah, blah, blah. Control. Obviously, it lacks. If it said the initial claim seems to lack, then it would be control, because we don't have that piece of things. Like we don't have the actual there's no data that actually shows those things are occurring. So that's what I'm trying to say there. And then, so there's no control, right? It's just like correlation. It's 100% correlation, which prediction is related to correlation. Prediction actually requires correlation, and that's how sometimes we can have these false statements being made. And then hypothetical constructs. There is hypothetical constructs in it. So like autism is a hypothetical construct, aggression is, but that's not the focus of the claim. The claim itself aligns with prediction because there's correlation. Correlation is there, making prediction the best answer. So prediction requires correlation. Correlation means if this happens, then that will happen. Essentially, like the sun rose yesterday, so I can say the sun rises today. That is how we're trying to make these claims because of correlation. Now, obviously, there's no data and they've recounted those, but that is why. So A is the best answer here. Prediction. How about this next one? Which of the following statements is least likely to be made by a radical behaviorist? A, thinking and feeling are behaviors, and like all behaviors, they are influenced by environmental contingencies. B, private events are not causes of behavior, they are behaviors themselves and can be analyzed functionally. C, free will is an illusion, behaviors occur due to the organism's history of reinforcement in current environmental conditions. Or D, behavior should be studied objectively under controlled conditions independent of unobservable internal states. All right. So our best answer here, again, you have to think about, well, what does a radical behaviorist thought process look like? Radical behaviorists take into account both internal and external events. This is contrary to methodological behavior that only looks at external events. So that's our framework for approach. A, thinking and feeling are behaviors. Certainly, a radical behaviorist could say that. So I like A. And like all behavior, they're influenced by environmental contingencies. Definitely, right? So A is a radical behaviorist through and through. B, private events are not causes for behavior. They are behaviors themselves that can be analyzed functionally. Again, a radical behaviorist might say that. So private events are not causes, right? Like a headache, not a cause for behavior. They are behaviors themselves. Or thoughts, not causes for behavior. They are behaviors themselves. So I like that. Probably can make some modifications there, but I think that's okay. A radical behaviorist likely would say that. C, free will is an illusion. So this means you take a determinist approach, which radical behaviorists would, right? Free will is in opposition to determinism. Determinism is what we follow from a radical behaviorist perspective. So I like C. Behavior occurs due to the organism's history of reinforcement and the current environmental conditions. So C is good. Radical behaviorists would say that. I also think a methodological behaviorist would say that. So if you're getting tripped up on C, the reason it also relates to radical behaviorism is because free will is an illusion. That means you take a deterministic approach, which a radical behaviorist does take a deterministic approach. D, behaviors should be studied objectively under controlled conditions independent of unobservable internal states. Well, no, we have to take into account those internal states in order to determine why a behavior is happening. For example, some of you have heard me tell this story before. I had a client who started engaging in severe head banging. He went to the dentist, found out he had a bunch of cavities. Cavities aren't observable to me, right, or measurable to me. And so we might have just accounted for head banging due to some environmental change. But instead, we looked at those internal states. So D, a radical behaviorist would not say that. We would look at those internal states. Radical behaviorism takes into account both internal and external, whereas methodological behaviorists would say D. They would only look at the environmental conditions. Cool. Okay. You study the dilation of pupils when presented with an external stimulus such as the sun, an LED light, or an incandescent light, a flame, and a black light. You take note of the level of dilation in response to the specific stimuli and determine which factors could impact this. Pupil dilation is a product of A, selectionism, B, empiricism, C, parsimony, or D, pragmatism. All right, so if you're looking for phylogeny, you'd be correct, but phylogeny is not an answer. Therefore, we would pick A, selectionism, specifically phylogenetic selectionism, right? This is evolutionary history. This is Darwinism. This is how a species changes over time to no relation to the consequences. You can't choose the level of pupil dilation. Like that's not something an organism could choose unless you're a lizard person, and we're not lizard people. So therefore, it is phylogenetic selectionism is the product, right? Pupil dilation is a product of. Sure, you could be empiricism could be present here. Empiricism, looking at data, making database decisions. You are doing that, but pupil dilation is not a product of empiricism. It's also not a product of parsimony or pragmatism, right? It is a product of phylogenetic selectionism specifically. If you had phylogenetic selectionism, you need to pick that. It's not one of the choices, so you pick the most specific answer given the situation. Here we don't have the most specific answer, therefore you pick A. Yeah, don't overthink it, y'all. Really read that last sentence. Make sure you focus on what the last sentence is saying, and then pick the answer based upon that. Someone said pupil dilation is also practical, but again, it's not a product of practicality, right? It's a product of selectionism, specifically phylogenetic. So, okay, next question. A recently certified behavior analyst participates in a multiple disciplinary research consortium. This just means different people presenting, investigating human performance optimization. During the presentation, the analyst delineates their specific orientation, asserting that their work involves the systematic manipulation of environmental contingencies to produce reliable changes on measurable behavior under controlled conditions, whereas the theoretical foundation of their discipline concerns the philosophical assumptions about the nature of behavior and its law and relations. This most closely aligns with, by this I mean the last part. So let me preface that. The last part most closely aligns with. So this piece here, whereas the theoretical foundation of the discipline concerns philosophical assumptions about the nature of behavior and its lawful relations. What does that relate to? Is it A, behavior service delivery, applied behavior analysis, behaviorism in general, or the experimental analysis of behavior? Pick the most specific answer. Yeah, so this is a little bit tricky. The best answer is C. So behaviorism is the best choice here, though a lot of you pick D, and I'll explain why D doesn't work. So this is talking about the philosophical assumptions, so that's a key piece, and the lawfulness and its lawful relations, basically between the philosophical assumptions and the nature of behavior. This is what we call the conceptual analysis of behavior. Y'all don't really need to know that anymore, though it does fall under behaviorism. And since behaviorism is on the TCO, you probably do need to know that. So that's the important piece. But so it's the conceptual analysis of behavior. This was previously on the test content outline. It's been removed, though it still falls within behaviorism. And just because something is removed, if it still falls within the science or that category, you need to know it, unfortunately. So conceptual analysis. Behavior service delivery is the implementation of behavior plans. Applied behavior analysis is the first part, creation of the plans potentially. And then the experimental analysis is research, laboratory, studying, so on and so forth. So this fits under conceptual analysis, which isn't a choice. Therefore, we pick behaviorism as the best option. Best option. How about this one? This. I'm gonna give you 2 minutes for this one. It's difficult. Yeah, someone said I picked D because of the philosophical aspect, and that actually fits under conceptual analysis. EAB doesn't worry about the philosophy around it. It studies, does this work in a controlled environment, is basically what that one focuses on. But anyhow, okay, a behavior analyst is contracted to evaluate a novel intervention claiming to improve academic engagement through exposure to subliminal affirmations embedded in instructional music. Upon review, the analyst notes that the procedure lacks operational specificity. I could say that 10 times fast. That the purported dependent variable are assessed, this is just the reported, via subjected teacher ratings, and that no functional relation have been empirically demonstrated between the intervention and the observed outcomes. Additionally, the researcher's rationale references holistic energy alignment rather than the reinforcement contingencies or stimulus control. The analyst concludes that the intervention fails to meet multiple specific criteria characteristics of the discipline. Which of the following best identifies the dimensions of applied behavior analysis being violated? Is it effective, technological, analytic, and conceptually systematic? Applied, effective, and generality? Conceptually systematic, behavioral, and applied? Or analytic, effective, and technological? I'm going to give you a minute to work through it. I would use pen and paper. I would start with answer A and I would look, okay, is there effective? If we're not meeting it, then maybe that's right. So on and so forth. All right, nice job. As you're working through it, lots of you are coming to A. So effective, let's look. Lacks operational specificity, so that's definitely technological. It also says there's no functional relation that has been empirically supported, so it's not analytic. So far we have technological and analytic. So we can get rid of B. We could get rid of C. We can get rid of not D yet. Additionally, researchers' rationales reference holistic energy, so definitely not conceptually systematic. So A is going to be our best one. And then the intervention fails to meet specific criteria characteristics. So it's not effective. It didn't produce a meaningful change. It's not technological. It wasn't specific. It's not analytic. There's no functional relation. And it's not conceptually systematic. So certainly all of those were not met. Therefore, that's where we fit best. This is one of those ones where it's not necessarily hard. It's just you have to work through it. And so that's what makes these tricky. Follow your process of elimination, work through it. Don't freak out when you get these long questions. Usually the long ones just mean you have to work through it. And so well done doing that. All right. Mike has Mike has provided therapy in the clinic setting for majority of his therapeutic career. He has recently been transitioned to an in-home client. When meeting with his behavior analyst, they tell him, "We know you will do great since you're a quick learner." Mike takes this compliment and allows it to boost his confidence. The behavior analyst statement seems to align most closely with which of the following: an explanatory fiction, circular reasoning, a hypothetical construct, or a positive reinforcer. All right. So we're specifically looking at the statement. So that's important. Always answer the question being asked. The statement here says the statement says, "We know you'll do great since you're a quick learner." That is an explanatory fiction, that statement. We're explaining a behavior based upon something that's unobservable or measurable. So quick learner, unobservable, not measurable. Therefore, we're using it to explain why they will do great. That isn't explanatory fiction. It only becomes circular reasoning when we say you'll do great because you're a quick learner, and because you're a quick learner, you'll do great. So it's when you use that circular fashion, which we didn't do. Hypothetical construct would be if the analyst said you are smart or you are a quick learner and just made that basic statement. It only becomes an explanatory fiction when you do that whole piece, when you do that whole piece. So that's not there. And then you have a a positive reinforcer. We don't know. Did the frequency of behavior change? I have no clue. Not enough information there. So these all come within section A or domain A of the TCO. They could fit in a couple places within domain A, but primarily A2. So how about this one? During a conference, a behavior analyst asserts that a client's self-injurious behavior is the direct consequence of unresolved internal thought conflict and maladaptive emotional regulation stemming from early attachment trauma. In response, another behavior analyst notes that such explanatory fictions merely relabel the behavior without identifying the environmental contingencies maintaining it. Duh. The analyst explains that both overt responses such as head hitting and covert events such as feelings or anxiety or thoughts preceding the act are a behaviorally analyzable phenomenon governed by the same operational principles. The behavior analyst perspective is most accurately characterized by exemplifying which philosophical orientation. So, methodological, radical, determinism, or pragmatism. Don't overthink it. All right. So, yeah, don't need to overthink this one. This is B, radical behaviorism. We're looking at internal and external events. So, pretty solid there. Don't need to go too far into it. Methodological behaviorism would only look at the external events, so what's outside of the behavior or the environmental factors. Radical takes into account both. Determinism is the lawfulness of behavior, and then pragmatism is picking an intervention based upon what has worked. So, those aren't really fitting within this category. Next, Marco implemented a systematic desensitization. I write this all the time and I can never pronounce it. Desensitization procedure to increase toleration for haircuts. I'm recycling the question. Kind of. Employing a changing criterion design with a terminal goal of sustaining a 10-minute haircut. The intervention began with the criterion of 30 seconds, then progressed 1 minute, 4 minutes, 6, 8, ultimately 10. By intentionally varying the magnitude of the criterion shifts across phases, we're demonstrating what? Behavioral, applied, conceptually systematic, or the analytic dimension. All right. So best answer here is D. Remember when we talked about this changing criterion design earlier, we talked about how in order to determine a functional relation in a changing criterion design, you can do a couple things. So number one, you can increase the magnitude of the changes. So that's one way. The number of changes is the second way. And then the third change is the bidirectional change, the bidirectional change. So those are all ways that you can help determine that functional relation. And so analytic is control. Behavioral, right? Uh, we're not necessarily demonstrating behavioral by changing the toleration amount, the number. So that's not behavioral. In fact, we might argue that this doesn't meet behavioral because it's tolerating is not a behavior. So if it said, what are you lacking? We might pick A. Applied is socially significant. For some people, haircuts are socially significant, but Marco is not doing this by changing the level there, changing the level, not necessarily doing that. And then conceptually systematic, this is using the principles of behavior. We don't know what the reinforcer is. We don't know what we're giving them after. So we probably are meeting the conceptually systematic dimension, but I don't know that, right? There's not enough information there. And so I need a little bit more. Like he did a preference assessment, and then he's giving them X, Y, or Z based upon the preference assessment. Then certainly we could pick C, but we definitely know it's C or it's D. We definitely know it's D. We don't have to add information. We don't have to stretch. Analytic is a functional relation. They're meeting these changes, or by meeting the changes, by varying the magnitude, we are establishing a functional relation. So that's an important piece of things there. Cool. Let's keep rolling. Sasha has trained her clients' caregivers to implement a token system in the home setting, which they do perfectly. By doing this, she is A, demonstrating the effective dimension of behavior. B, she is setting them up to engage in behavior service delivery. C, she is demonstrating a pragmatic approach. Or D, she is taking a radical behaviorist approach. All right, so the answer here is B. Whoa, the dog just opened the door. What are you doing? What the heck?
Sorry.
I'm not even joking, y'all. My dog just opened the damn door. Okay, continuing on. Distraction. The best answer is B. She's setting them up to engage in behavior service delivery. So what is behavior service delivery? This is the implementation of behavioral-based principles inside. And that's what we're doing, right? We're teaching them so that way they can go implement it at home. That would be behavior service delivery. Now, why is it not these other ones is probably what you're wondering more so. You should scoot up a little. So A, demonstrating functional or the effective dimension. Nothing in here tells us that, it's working or not. We don't have any measurements, so it's not the effective dimension. C, demonstrating a pragmatic approach. Pragmatic is practical. We train them using a token or train them to implement a token system. It's not focusing on how they train them. If it focused on how they train them and it said we're using something that's worked before, then the pragmatic approach would work, but it's not focusing on the how. So C doesn't work. And then D, taking a radical behaviorist approach. Nothing in here is really talking about like why we're selecting what we're selecting or how we're selecting it. So there's no focus on D. Behavior service delivery is the implementation of the plan, right? So we're training them to then go and implement the plan. That's what we're doing here. If it says, what is the analyst doing? The analyst would be engaging in applied behavior analysis, which is the creation of the plans, whereas the caregivers are implementing the plan. So that's like the difference there. Good. All right. Next one, last one in this set, and then we'll take a short break. Franklin exhibits significant difficulty during transitions, frequently running into an open doorway while moving through the hallway. This topography of elopement is highly disruptive and necessitates a restrictive environment to ensure safety. In response, his behavior analyst implemented a closed-door policy throughout the clinic. Following the introduction, sometimes my brain works faster than my mouth. Following the introduction of this environmental manipulation, no instances of hallway elopement have occurred. This most closely resembles determinism, cultural selectionism, parsimony, or pragmatism. What he did most closely resembles. What did he do, and what does that resemble? Okie dokie. So what are we doing? Number one, I have to find it, what he's doing. Um, the topography of elopement is highly disruptive and blah blah blah. So in response, the behavior analyst implemented a closed door policy throughout the clinic. So we made an environmental manipulation by closing the doors. It says, following the introduction of the environmental manipulation, no instances have occurred. So this is parsimony, simplest explanation, right? We are simply closing the door, simplest explanation. If we don't want people to run out into the hall, then we close the door. That's parsimonious. Pragmatism would be doing something that's worked. So if it said previously, when elopement has occurred, they used response blocking. And so now they have a policy where they put a bodyguard at the door and block every instance of elopement. Then that would be pragmatic. Pragmatism is doing what has worked. Parsimony is the simplest explanation. Usually, an environmental manipulation is parsimonious, not pragmatic. Cool. Determinism, this is why the behavior occurs. So if the question focused on why the behavior was occurring, then we might have a deterministic approach. But it doesn't seem to be focusing on why the behavior is occurring. From there, cultural selectionism, not happening here. So we have no cultural selectionism. Okay. Yeah, this is the end of the question set. Someone said, I use parsimony to rule out the other ones. That's good. Okay, we're gonna go ahead and take some questions. So if you have them, you can put them in the chat. If you have specific like vocal questions, you're welcome to ask those as well. I'm gonna take 2 seconds to take a drink of water. All right. Go ahead, Bree. Bree's unmuting some folks.
Oh, hi.
Carmen, what's up?
My question was for slide number 48.
Cool. Do you want me to go back to it?
Yes, please.
No problem. 48. Okay, what's up?
Okay, so I heard you say that you like the A as the answer, but I didn't understand why D was the correct answer.
Okay, so radical behaviorists would be least likely. So it's a negation question. A radical behaviorist
Uh,
would not say that. So a
yeah.
methodological behaviorist would. Does that make sense?
Yes, yeah, I missed the least likely. And now I know why I got it wrong.
Okay, cool.
Okay, thanks.
Yep. What's next, Bree?
Someone's having trouble discriminating between parsimony and determinism. What could be a good approach?
Parsimony is just the simplest explanation, whereas determinism is why the behavior occurs. So that's like the difference there. Real quick though, totally unrelated, but should I take the spread on Seattle? Okay. Sorry,
Shoot, I just unraised someone's hand to meet them,
Mohammed.
but now I lost his name.
Okay, no worries. Okay, so there's some. If you,
You have to answer.
Mohammed, you could re-raise your hand. All right, there you go, dude.
Yes, hi, Miko. Can you go back to slide 36, please?
36?
Yes.
Yeah, I sure can. Bree told me I have to calm down though, so let me tone it down here. Here you go.
For the question, let me make sure this is the slide.
Yeah,
Yeah,
no problem.
36. Yeah, for number C, the answer number C. You said it says then, but it says that. So if it's that, does that make it the correct answer? Because it doesn't say then, it says that.
That was a typo, but it doesn't change the answer.
But it says then.
But
I fixed it. No, in the answer choice.
Oh, no. It doesn't change the answer.
so if it's that, it's still not the correct answer?
Correct.
All right. Got
Yep.
it. Thank
Yep.
you.
No problem. What else? Anything else? Okay, there's some written questions. Let me get to some of these. Someone said I had a question about 44. I thought it was a cumulative graph. 44. Slide 44. Uh, slide 44? Wait, hold on. There's so many things here. I think it's a different question. For circular reasoning, in order to pick circular reasoning, it should have that circular fashion. So, if this is the case, then that is the case. It should use the whole circular motion in it, if it's circular reasoning. So, yes. Difference between procedural integrity and treatment integrity. Again, there's no real difference. Procedural fidelity relates to all phases of a study. Integrity relates to the implementation of the intervention. The Cooper book states they can be used interchangeably.
I'm gonna unmute someone for you. They
Yep.
have a question about slide 42.
42. Okay.
Could you just talk about the bidirectional aspect of this again?
For
I'm
sure.
Yeah, I don't think I comprehend it super well, and I know you talked about it, and I think I just like need a one over.
Yeah, no problem. So a bidirectional change is just returning to a previous criteria level. Because in a changing criteria on design, right, you have the little dotted lines that indicate the criteria. That means if the behavior conforms with that criteria that I've set, they receive reinforcement. So I set the criteria. So if I change the criteria back and the behavior goes back, then it's my change that's causing it. So that bidirectional change is the best way to determine a functional relation in a changing criterion design.
So in that in a graph, is that when it like is going up and like there's like the dot and the little line and then it goes down really quick?
Yeah, I can show you real quick. Hold on one second.
Okay. I feel like I'm like able to vision it in my head, but I just want to make sure I'm on the right like track because this question tripped me up.
Yeah, for sure. Let me pull up our other breakdown the beast and find it real quick. Control find. Uh, Hold on, my computer is deciding to be super slow right now. Okay. maybe I don't have a picture. If you email me, I can send you a screenshot because I know I have a question somewhere. I just don't know where it's at right now.
Okay, no worries, but thank you so much.
Yeah, of course. The difference between analytic and applied. Analytic just focuses on what behavior you're targeting and is it socially significant, whereas analytic is there a functional relation? Analytic stands for control. That's why you have the C at the end, the C at the end. Having trouble discriminating between parsimony and determinism. Well, determinism more so is focusing on why a behavior happens, whereas parsimony is a change to then decrease or increase the behavior. So one is focusing on the occurrence of the behavior, and the other is focusing on how you intervene to change the behavior, which is parsimony. Someone said looking at the distance between each intervention, I knew, yeah, that could be, but the distance could also be an alternating treatments design because we use what we call differentiation, which is the distance between the changes, right? Cool. Got it. For radical behaviorism, it counts private events as behavior, but for ABA, we only count observable and measurable behaviors. No, you can account for private events with ABA, but you don't try to change private events. So you can account for them, but you don't try to change them. So there's a difference. All right, so okay, so a couple things. Number one, we're not gonna have time to get through the rest of the questions. So I think what I'm gonna do is we'll do about 5 from this question set. And then, but someone else has a question. Yeah, you can, if you need to ask it, you can hit the little hand emoji. Oh, you did. I don't, it's not up.
It's
Yeah.
there's been like waving and all kinds of things.
Oh, okay. So there's like a specific, hold on, I think I can you find them? I can find her. Okay, there you go. Now you should be able to hit unmute.
Yeah, so I have a question from the previous slide that you were in.
This is the previous question?
Yeah, for the no, the graph. When it comes to the graphs that
Oh, I think 42.
biometrical, I think.
This one?
42, yeah. So the keyword there would be systematically, right? Like if we wouldn't have that word, could we maybe select A?
No,
As a
because no, it systematically does help you know that it's changing criterion, but you still can't pick A because sitting in a chair is non-reversible. Once you know how to do it, you can't reverse it. So you can't return to baseline levels. Again, once you know how to sit in a chair, you know how to sit in a chair. So you can never pick A for this one.
But I thought it said that it's increasing the amount of time that you sit in a chair.
Correct. But one of the first things you look at with a change or with a reversal design is the behavior irreversible? Because once you know how to sit in a chair, then you can't reduce it. You can't remove the intervention. So you wouldn't start with that. So when you see increasing the amount of time, that should tell you that you're looking for the change of criterion design because that's the one that focuses on increasing or decreasing amounts of behavior. So you're cluing in on the right part, you're just associating it with the wrong design.
Yeah, because the way I see it is like I can, of course, I cannot reverse the fact that you know how to sit in the chair, but I can reverse the fact of the amount of time that you sit in a chair, which is the way I was seeing it here. When systematically increasing the amount of time that a learner sits in a chair, it doesn't say that the learner learn to sit in a chair. It just says that the learner increased the time sitting in the chair. Maybe you implement an intervention to work on this. But if you take off that intervention, then the client may start with the maladaptive behavior again of like getting out of the chair and all that.
Yeah, so but your first whenever you pick a reversal, the first thing I want you to look at is it reversible or not? So I know what you're saying, right? Oh, we should be able to reduce the amount of time, but you still look at the behavior first. And so there's a better design if you're worried about amount of behavior which is changing criterion design is the best design for amounts of behavior. You wouldn't use a reversal design for that.
Oh, okay. Thank
Got it.
you.
Yep.
Can you please pull up slide 56?
56. I sure can.
Yes, so the comment boosted the therapist's confidence is why I thought it was a positive reinforcer.
Is confidence isn't measurable or observable, so it couldn't be a positive reinforcer because I can't measure that.
Now, if it said that it increased his confidence and he started doing more clients or something measurable, then would positive reinforcer be a better answer than explanatory fiction or no?
Well, first off, the question says, what is the statement? So I don't know that there could be a better answer. There could be another answer that works, but there wouldn't be a better one because that statement is always an explanatory fiction. If you didn't have explanatory fiction and it said, what does the statement function as? And it said that after the statement is made, they implement 20 times as many procedures. Then sure, you could pick positive reinforcer, but you would have to be asked, what does it function as?
So I guess I'm missing a lot of questions because I don't think if it passes the dead man's test, is that something you recommend we do in every question before we jump to an answer?
I mean, the dead man's test is one of the foundational questions that you should ask yourself. So definitely that should be like ingrained into how you approach questions, I would say.
I also missed a couple of questions where there was like it was least likely, which is not, and I just jumped to answering which is, and I just don't know how to slow down my mind there.
Yeah, I mean, I would use your whiteboard and write the negation like hints on your whiteboard so that way when you see those, you can focus on it. We also have a negation mini mock, so you can maybe look at that. But all right, let's go ahead and jump in. Like I said, we certainly won't have time to finish all these. We're gonna try to do five. We're gonna try to do five, and then we'll have a little bit of time for Q&A, and then I'll show you guys like where to access the recording and all of that. So, but since I'm picking and choosing what five, I want to pick. There's a couple of ones I really like from this section, and I think I need to go from the bottom down. So I'm going to skip to the bottom, and hopefully I don't give anything away. Okay, so we're gonna start with this one, and then we'll go backwards. Then we'll go backwards. So, so start with 92, and then we'll go to 90 next. But okay, a BCBA has developed a token system for a client that has effectively increased appropriate behaviors and decreased maladaptive behaviors. The BCBA has shared the effectiveness of this behavior change procedure with caregivers and other key stakeholders. Which of the following may constitute a challenge for the BCBA? A, the client may not have the needed prerequisite skills. B, it may be difficult to maintain an effective menu of backup reinforcers. C, the token system may be self-perpetuating. Or D, tokens may become an ineffective reinforcer. This is one of my favorite questions from a mock we discontinued. All right, hard question. The answer here is C, and let's talk about why it's C. A lot of you picked B, and I'm gonna give you a rationale as to why B doesn't work. So, okay, number one, what's happened? We've used a token system. The token system has effectively increased appropriate and decreased maladaptive. At this point, this tells me we've reached what we call habilitation. Our skill set is maximized to contact reinforcement and minimize punishment. So we've reached a state of habilitation. From there, what do we do after we've reached the state of habilitation? Well, we remove the intervention. We remove the intervention. And so now I need to think about what answer fits that. So A, the client may not have the needed prerequisites. If you use the token system, then you have the prerequisites. So we know that worked. We already had the prerequisites. Then we look at B, and I want you to look at D in the same vein. It may be difficult to maintain an effective list of backup reinforcers. Does that matter? It doesn't, right? Because you need to be shifting to naturally occurring because the skill is already in your repertoire. So honestly, doesn't matter that you can't maintain backup reinforcers. In fact, I don't want the backup reinforcers to work anyways. I want naturally occurring reinforcers to work. And then D, tokens may become an ineffective reinforcer. If you pick B, my question would be why not pick D? Because if the tokens don't work, then the backup reinforcers don't work. So these are very similar answers that I want you to see. But anyhow, D doesn't matter either. Who cares about backup or who cares about the tokens? We need to be shifting to like naturally occurring things anyhow. So that doesn't work. This leaves us with C. The token system may be self-perpetuating. This is listed. There's 4 challenges to token systems. These are the 4 listed right in the section in the Cooper book. But when I look at C, tokens may become self-perpetuating. Well, self-perpetuating means it maintains itself. So you do this because it works, and it works because you do it. You do this because it works, and it works because you do it. And so we continue to utilize a token system because they work, and the token system works because we continue to do it. When something works, your caregivers might not want you to do it. But that's your key. That's your key. It's the self-perpetuating piece. It works because you do it, and you do it because it works. So hope that makes sense. All right, we're gonna go back to 90 now. Another one of my favorites. I don't want to give away answers, so I gotta make sure I do this the right way. All right, Tanya is a 3-year-old female. She currently lives with her mother and father. She enjoys ripping the heads, the heads, legs, and arms off her dolls. This is like the kid from Toy Story. What's his name? Sid. Her father thinks it's hilarious and cackles when she does it. Her mother, on the other hand, does not think it's funny and simply walks out of the room. When her mother walks out of the room, Tanya begins to scream and rip the heads off as many dolls as possible. Tanya's mother's actions best exemplify punishment, extinction, reinforcement, or differential reinforcement. All right, so best answer here. Best answer here. Well, number one, you have to know um what are the effects of the different procedures. So punishment leads to an immediate decrease. This behavior actually increased, so it's not punishment. Extinction leads to an immediate increase followed by a reduction. So it could be extinction. Reinforcement leads to a gradual increase. This is an immediate increase, so it's probably not reinforcement. And then differential reinforcement doesn't really fit here. The other thing, we see the dad is laughing, right? So that's adding attention. The mom removes attention. So the dad could have been reinforcing it, and then the mom removes that source of reinforcement, which is extinction, which leads to an extinction burst, which gives us our answer of extinction. We know it's an extinction burst Because we see a increase in the magnitude of the behavior. She's beginning to scream frequently, and she's or no, sorry, she's screaming, which is extinction-induced behavioral variability, and she's ripping the heads off as many dolls as she can find. So not only do we have screaming, but we have that behavior changing a little bit too. So we have extinction-induced behavioral variability, and we have an extinction burst, which tells us it's extinction. Again, if it were punishment, we'd have an immediate decrease. If it were reinforcement, we might have a gradual increase. And if it's extinction, you have a sharp increase, and then sometime down the road, you see a decrease. So extinction fits best. The other thing that we see here, again, you're seeing the dad do one thing and the mom do another thing. So that's going to tell us that it's an extinction burst as well. So those are your kind of keys there. All right. Now I need to go to 88. Oh, I'm gonna give you guys all 2 minutes for this one. I love this one. This is a hard one. So Layla is a typically developing 15-year-old female. Layla's caregivers are concerned that Layla uses vape sticks. She systematically uses them when she has an upcoming test assignment or when her parents have given her major tasks to complete. Her caregivers have consulted with a behavior analyst who is knowledgeable about addiction. The BCBA created a plan that included reducing the amount of time that Layla vapes systematically from current rates to 0 per week. What, if anything, could be added to the plan? Is it A, terminate reinforcement for Layla's vaping by replacing the vape stick cartridges with ones that have no nicotine in it? B, increasing opportunities to contact reinforcement from her parents, such as talking with them about stress and how they can help her. C, encourage Layla to take deep breaths and write a simple task analysis when she has an upcoming test, assignment, or project. Or D, terminate and pause tests and assignments in order to reduce vaping. All right, so our answer to this one is going to be C. So let's talk about why, though. It's a hard one. Section H question through and through. So the reason C is the best answer. So number one, a couple keys. When you see the function of the behavior, or sorry, when you see the age of the individual, you want to think about that. So 15, that's important. From there, you want to think about the function. So here she does it when she has an upcoming test or assignment. So it's probably escape, but she also does it to relieve stress, right? So relieve stress. Somewhere in here it says that. Does it? She uses upcoming test or assignment, major task, blah, 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 blah. Her parents. Wait, hold on. I know it says it in here somewhere. It doesn't say it. Okay. Anyhow, she has it when she has an upcoming test or assignment. So that tells us that it could be escape maintained, right? From there, her parents want to reduce it to 0. So we know that's important. So if I look at A, terminate reinforcement for vaping by replacing vape sticks that have no nicotine in it. A doesn't work because, again, she's 15. She shouldn't be vaping regardless. Doesn't matter if they have nicotine or not. So A doesn't work. B, increase opportunities to contact reinforcement from her parents. So if it was attention maintained, then B works. But it's not attention maintained. And such as talking with them about the stress and how they can help it, blah, blah, blah. B doesn't work, right? B is not focused on the escape maintained piece. So C, encourage Layla to take deep breaths and write a simple task analysis she can use for upcoming tests, assignments, or projects. So now we're creating a way that she can approach tests and assignments when she has them. That's going to be that piece of things. From there, terminate or pause assignments, tests. That's not realistic. Again, she's 15. It doesn't work when she's 15. So D doesn't work due to her age. A doesn't work because we shouldn't be vaping regardless. And B doesn't work because it's not giving you the function. Someone said, is B not mediation? No, it's not, because the function is escape. They're not giving her escape, so it's not mediation. So there's that. Okay, cool. We're gonna go ahead and pause there. We'll open it up for questions and answers at this point. And then I'll use these questions in the future, so you'll get new questions later. But let's go ahead and stop. Won't B help with stress management? Probably not. It depends. Like, does talking with her parents help her relieve stress? I don't know. It doesn't say that. So all I know is that the function is escape, and we need to teach her how to appropriately access escape. So I would say no, it doesn't, or at least it doesn't matter if it does. Can you explain the difference between hypothetical constructs, circular reasoning, and explanatory fictions? I can. Turn my camera on. So a explanatory fiction is an unobservable, or sorry, yes, an explanatory fiction is an unobservable characteristic. This is ego, this is autism, this is ODD, explanatory fiction. From there, we want to look at, what am I doing? Hypothetical construct is ego, autism. So this is the unobservable characteristic. Explanatory fiction is when we take that unobservable characteristic and we use it to explain behavior. So now saying you aggress because you have autism, or you elope because you have autism. That is the explanatory fiction. Circular reasoning is when we do it in that circular fashion. So you have autism because you aggress, and you aggress because you have autism. So if I use that circular fashion, that's what that's going to be. What else? What else? What else? What else? Okay. You're
Go
welcome.
back. Yeah,
Yeah.
can we just go back to question 91?
91. Yeah, here you go.
Yes, so I'm confused here because what I've learned about extinction is everybody ignoring the behavior. But here it doesn't say anything. So we have two people here, the father and the mother. So one of them is giving it attention and the other one just walked out of the room. That is simply what this question looks to me like it's asking. So it doesn't
So
say anything about when
real quick, it says
dad.
what does Tanya's mother's actions exemplify? So
Yes.
the mom is removing attention. It's
So
important to know that attention was provided, because the definition of extinction is the removal of reinforcement for previously reinforced behavior. Technically,
can I say something real quickly, please? So the only reason I thought this was reinforcement is I thought about stimulus control. So the behavior is reinforced in one and then is not in the other, because we have two stimulus here. But the question, Taya's mother action are exemplified by, so it makes it a little confusing.
sorry,
As
what's the
to
question?
Yeah, the question is, why can it be reinforcement? Like, why isn't it that Tanya's mom is reinforcing Tanya's behavior? Because if mom is not saying anything, her behavior is increasing. In the presence of mom not doing anything, mom just walking away, mom looking at her and walk away. And then here, it looks like when she does it, dad thinks it's funny, but the behavior still increases. I mean, she's still doing it. That's what I thought.
So an extinction versus an increase in the behavior, right?
Yes. So why is it that the behavior is being extinct and not increasing, just like the question said. Like, I mean, just like the scenario portray as if as if Tyan's behavior is increasing.
Correct, but
And not
extinction leads to an increase, right?
yes, it does, but I didn't think about it that way.
Yeah. So if this is an extinction burst, reinforcement would be a gradual increase. So the effects of the intended effects of the procedures, the intended effect of reinforcement is a gradual increase. The intended effect of punishment is an immediate decrease. The intended effect of extinction is going to be an extinction burst, so an immediate increase followed by a gradual decrease. Here you have an immediate increase, so that meets the intended effect of extinction. But again, reinforcement is the delivery of an appetitive stimulus or the removal of an aversive stimulus. If attention is aversive, then sure, this might be reinforcement, but then you would see she continues to rip the heads off dolls. You wouldn't see an extinction burst. So that's the difference that you're looking for there.
Okay.
Mm-hmm. Okay, can you explain demonstration of functional experiment control in reversal in phase 3 and 4? Not necessarily understanding that question. Can you email that one to me? I think what you're asking though is how do you demonstrate a functional relation in a reversal design is what I think you're asking. And in a reversal design, you demonstrate a functional relation by removing the intervention and going back to baseline. So that return to baseline is how you demonstrate that functional relation. But you need those three effects. So you need baseline, intervention, and then you need that return to baseline.
Can you please pull up slide 25?
20. Oh, pulling it way back, huh?
So yeah, the first section, you remember there was not enough time for all the questions, so.
Here it is.
I really got confused because the way the question is written, I felt it implied that we are observing lack of attention preceding the problem behaviors, which is like narrative because it's only telling the antecedent before the problem behavior occurs.
No. So how would you know the percent of time the behavior doesn't occur? How would you know the other 30%? Because you're taking continuous. Narrative, your data is always going to produce 100%, right? Because you're only taking data when the behavior occurs. So if you only took data when the behavior occurs, you would always have 100%. The only way you have anything under 100% is by continuous because you have to know when that behavior is not occurring.
But it does not say that I'm recording antecedents or consequences when
Prior.
behavior is not occurring.
Yes, it does though, right? It says indicating that attention was missing prior to 70% of problem behavior. So that means attention was not an antecedent some of the times. So it's telling you that. But get rid of that. Conditional probability is only related to continuous because continuous tells you when the behavior happens if a certain antecedent is present and when the behavior happens when the antecedent is not present. So when there's attention and when there's no attention. Is what conditional probability would say. So like take a behavior, aggression. Let's say I'm taking ABC continuous on aggression. ABC continuous would say aggression occurred, the door opened 50% of the time that aggression occurred. Well, then I know the door opened 10 times, but aggression only occurred 5. So then I know the aggression didn't occur 5 times. That's how you get conditional probability. 50% of the time that the door opens, aggression will happen. ABC narrative would just say the door opened, aggression happened. It wouldn't tell you about any of the times that it wouldn't tell you about any of the times that aggression did not happen. Therefore, you could not gather conditional probability from it.
Thank you. And do you have time to go back to slide 11?
Yeah, for sure.
Okay, so this is because matching law is only applicable if there is
2 interval schedules.
Correct. So if there is a ratio, then there's a tendency to go with ratio. Why is it human nature to go with ratio?
Say it again.
So why are we assuming he will only engage in option B?
Well, we're not assuming that. The principles of behavior tell us that because it's on a ratio schedule. You complete his organizational checklist. So all we know is we have to complete the checklist, then you get reinforcement. So that's telling us do the checklist, get reinforcement. There's no time component that you have to wait. You just do the behavior and then you get reinforcement.
What if the organizational checklist is extremely
Again,
tedious?
it doesn't say that, so you're adding information. You don't have to add that. You just go with he completes the organizational checklist. If it was important that the response effort was greater, it would have been there. That's not important though. What's important is that this is one behavior, one thing you have to do as compared to having to wait an interval. So regardless, it doesn't matter what this says. It matters that this is a ratio and this is an interval. You have to separate those things. If the response effort were important here, it would be in the scenario, okay?
So if matching law is not even applicable, I mean, why is the last sentence of the question worded based on matching law, which is not even applicable in this scenario?
Well, it is applicable. Matching law says behavior goes where reinforcement flows. If reinforcement is present every time you do a behavior, that's where your behavior flows. The calculation of the matching law is still applicable because the calculation is 100% of the time you will do option B. So it is applicable. It's just the interval piece, the varied responding is not applicable because there's not two intervals.
So only, okay, when we're calculating the weighted responding, only if there are two intervals. But yeah, it's applicable because we'll go with the ratio or the
Yeah,
one
and
with.
you still have your rate of responding. It's 100. It's just always going to be 100%.
Okay, thank you.
Someone said, "Can I go back to slide 48? Why is it not pragmatism?" I don't know. Let me look. 48. Why is it not pragmatism? Well, pragmatism isn't the question's not asking about pragmatism. Oh, 49. Pragmatism, practical interventions, because it says pupil dilation is a product of. It's not a product of pragmatism. Pupil dilation isn't it's a product of your selectionism, right? It's a product of phylogenetic selectionism. There's nothing pragmatic about it, right? Oh, wrong slide. Okay. I'm not sure. The recording will be up, so if you find the slide that you're relating to, you could always email us your questions. So um, sweet. Okay, so a couple things. If you're a part of All You Need, I'll upload this. I gotta edit it, so probably is not gonna get it uploaded on Monday, to be honest with you. Maybe Tuesday. But I'll upload this in the last section I boot camp, probably Monday or Tuesday, likely Monday, hopefully. They'll get uploaded tomorrow, which is Monday. I'll also post this to YouTube on Monday. So if you purchase this independent, or this was free. So if you came and you want to rewatch it and you registered, you can access it in your account for like 30 days. If you outside of those 30 days, it will be in your on YouTube. So on our YouTube channel, check it out there. If you like this, we have lots of other things. Feel free to email us. I can hook you up with a coupon code if you just registered independently. So there's how you have that.
I just wanted to know when the Beat the Beast for November will be added.
There was not one in November. We'll be doing a surprise one coming up soon, so just pay attention to our socials for that. Whoops.
Socials, you mean Instagram?
Say it again. Socials, yeah, Instagram. It could be there. We also post to just Instagram actually. So yeah.
Oh, okay. So what is the Instagram handle? Because I'm sorry, unfortunately, I'm not following.
So what?
Instagram handle?
Just behavior underscore analyst underscore supervisor.
Underscore two underscores. Okay.
Behavior underscore analyst underscore supervisor. Yep.
Okay.
Cool. Someone said, how about the next test content marathon? The next one of those will likely be in March, would be my guess, but maybe February. The next boot camp probably around a similar time. Parsimony is the simplest explanation. So parsimony is usually like an environmental manipulation or something like that. Pragmatism is doing what has worked. So if you have an intervention that's worked and you implement it again, that is pragmatic.
So for people who have all you need package, is this the breaking down the beast session number 27? What would it show up as in the account?
Yeah, but I mean, it'll be whatever the newest one is, so probably 27.
Thank you.
Whoops. So sorry, I just muted you. You can unmute yourself. My bad.
No problem. I just want to ask when the new dates will be added to the slides.
But yeah,
The
by
new
the
dates
first by the first of the year, we'll have all the dates for next year out.
Perfect, thank you.
Cool. You can email info@behavioranalystsupervisor.com if you have questions, or if you like registered independently and you're interested in other materials. You can email us there, and I can hook you up with a discount code. Cool. All right, y'all. Well, I'm gonna go watch the Seahawks, and hopefully they win today. Took the spread. Don't know if it was smart, but we'll see. Take it easy. Bye, y'all.